Good morning, everyone. I'm Jerry Schmidt, and I'm the current president of NAADAC, and in my real life, I'm the Chief Operations Officer at Valley Healthcare System in Morgantown, West Virginia. I want to welcome you all to the SAMHSA NAADAC West Virginia Workforce Forum. Very proud that West Virginia is one of 4 states chosen nationally to host the forum, and we're going to share with you a lot of information over the next several hours, but we're pleased that you're here. We're live streaming. We'll talk about that a little bit more as we move along. Somebody said they can't hear me. That's real unusual. But anyway, we're going to do some introductions and welcomes, and then talk to you about what's in store for you today. First person I would like to introduce to you is, she goes by Victoria Jones, but most people know her as Vicki Jones, who is the West Virginia Bureau of Behavioral Health and Health Facilities Commissioner. Vicki's been around a long time. She's certainly a champion of what we do and in support of that. And I'd like to introduce to all of you Vicki Jones.
Thank you so much, Jerry, and good morning to everyone. Can everyone hear me? Perfect. So today, I just want to say a big thank you to several individuals, several entities rather. Marshall University, our federal partners, NAADAC, the addiction professionals, and the association, and SAMHSA, the Substance Abuse and Mental Health Services Administration, and the Bureau for Behavioral Health and Health Facilities have joined forces to provide information to each of you on mental health and substance use disorder disciplines. In addition to those of you that are sitting here today at Marshall University, and Jerry spoke a little bit about this, we also have students watching this live stream around our state in 8 different locations. And I'd like to name those locations because I really want to thank everyone that is involved in this workforce forum. We have Bluefield State College, Bridge Valley Community and Technical College, Concord University, Eastern West Virginia Community and Technical College, Irma Bird Higher Education Center, Southern West Virginia Community and Technical College, West Virginia University, Willing Jesuit University, and of course the students here and all of you here today at Marshall University. And I really want to again take a moment to thank you for your desire to improve the workforce capacity in West Virginia and for your willingness to participate in the forum today. This collaborative approach will make a difference, not only for each of you, but really for West Virginia's future. It's no surprise the challenges we face as a state. I think often we read about issues in the newspaper regarding substance use and abuse, and we're challenged with how to find solutions to those problems. As a result of the increased need for mental health services in West Virginia, the substance abuse epidemic West Virginians face today, and statistical expectations for the future, it is critical to build awareness and educate our students about the benefits and opportunities that exist in these professions. I have had the honor of serving as Commissioner for the Bureau for Behavioral Health and Health Facilities. For the Commissioner for about 8 years, but in the Bureau itself for about 16 years. I also came from the private sector as well. I've also served as the chair for the Governor's Advisory Council on Substance Abuse. The governor at that time was Governor Tomlin, and in 2011 created the Advisory Council to find solutions and make recommendations to his office as well as to the legislature, and to do so with community input. As a result of that, regional task forces were also formed, and as a result of that, through executive order, we have met 120 times across the state in our regional task force meetings, and an additional 14 times in the Governor's Advisory Council on Substance Abuse. Today, I have the honor of reading on behalf of Governor Justice a proclamation that has been signed by him as a result of this most important workforce forum. This is the proclamation that he has signed, and it says, whereas the current opioid crisis and the thousands of lives affected by alcohol and other substance use and/or mental health disorders is coinciding with a nationwide shortage of professionals trained to work in this specialty field. And whereas building West Virginia's addiction and mental health system of care will directly impact prevention, treatment, and recovery of substance use and opiate-addicted persons, and whereas the addiction and mental health workforce must grow and strengthen to manage the increased community demand for service, and whereas college students graduating with degrees in counseling, addiction, and social work are, by choice, entering the private and public sector, and whereas a commitment to statewide strategies is needed to address student recruitment, retention, and long-term professional career choice in the public behavioral health system, and whereas to help more students recognize the benefits of a long-term career in the public behavioral health system, the Substance Abuse and Mental Health Services Administration, the Association for Addicted Professionals, the West Virginia Department of Health and Human Resources for Behavioral Health and Health Facilities, Marshall University and the West Virginia Higher Education Policy Commission have partnered to promote college student and provider involvement in a West Virginia Behavioral Health Workforce Forum. Now, therefore, be it resolved that I, Jim Justice, Governor of the great state of West Virginia, do hereby proclaim April 25th, 2017 as Behavioral Health Workforce Forum Day in the Mountain State, and encourage colleges, universities, and community providers to join this collaborative partnership to increase student and professional awareness about the availability and benefits of a career in the public behavioral health system. In witness whereof I have hereunto set my hand and caused the great seal of the state of West Virginia to be affixed. This is something that Governor Justice has prioritized, Cabinet Secretary Crouch has prioritized, and all of West Virginia has prioritized to address the epidemic that we face today. Time and again, the groups that I have served on, the individuals that I have worked with, and many of you sitting in this room today and are probably hearing from the live stream, have identified the need to strengthen and grow our workforce to meet the needs of West Virginians whose lives have been affected by substance use or mental health disorders. We are near completion of a workforce report that provides greater specifics on the composition of our current behavioral health workforce here in West Virginia, as well as the extent of the need to continue to grow and strengthen this workforce. The statistical information we learned from our review and development of this report and the momentum we are building here today will help us to create opportunities for the future. All of this ties together the prioritization and the urgent focus we have on jobs for our workforce and the addiction crisis West Virginia faces with positive, concrete action for West Virginia communities. Please take a moment to consider, as you're sitting here today and as you're listening across the state, all that is discussed today. Become involved and join us. We have work to do, and you are part of the solution that will make a difference for all of us in West Virginia. Thank you.
Thank you, Vicki, and thank you for reading the proclamation from Governor Justice. Our next welcomer will be Kimberly Walsh, who is the Deputy Commissioner for the Bureau of Behavioral Health and Health Facilities. Kim?
Good morning. How's everybody? Either here or remotely, I welcome you. Very excited to be here today. This is an important opportunity for us to talk as a state about how we evolve our workforce to meet the needs, both current and going forward, of folks in our state that are struggling with mental health conditions or other addiction issues, and we need to be able to serve them and serve them with open arms. And as Vicki just talked about, we have a shortage of behavioral health workforce in our state, and I just can't say enough about how important this work is. And I'm going to talk to you for a few minutes about my own experience and what I have experienced through the 32 years that I have been in the field and practiced both as a social worker and clinician. I currently serve as the Deputy Commissioner with the Bureau for Behavioral Health. Our office acts as the single state authority for substance abuse as well as mental health conditions as designated through the Substance Abuse Mental Health Services Administration. Through this work, you know, for the last 8 years as Deputy Commissioner, the work that I've been involved with is just simply amazing. I have enjoyed every minute of what I've been able to do. I've traveled in every nook and cranny of West Virginia with the task forces that were referenced just a few minutes ago that were established by the Governor's Advisory Council. We have met 120 times, so you can only imagine in 120 meetings we've been in every different area of the state. And I grew up in West Virginia and quite frankly didn't know that some of these places existed, but I do now. And the good thing is that I now have not only contacts, but over 120 meetings. You actually get to know people and have long-standing relationships with them, and listening to what their experiences are and listening to what their needs are and what you can do to best serve communities. One of the things that we all know, if you grew up in West Virginia or if you've lived here for a long time and worked here, is that no area is the same. Every area is different, and so we have to pay attention to those needs. And I think over the last 8 years, we have prioritized paying attention to those needs and the different workforce issues, certainly, that are there, but the service needs and how to best deliver those services in communities. You know, I have met people over those 8 years that have told stories, and it was our job and my job, both as a social worker, as a professional, but in my role, to listen and to listen well so that we knew exactly what the message was that people were sharing with us and how best to address those issues. People's lives have been, as you all know, many of you probably personally or know someone personally, people's lives have been forever changed by the addiction issues that we faced in West Virginia. I believe and I'm confident that we will overcome this and we will move forward and we will create wellness in our state. But that's critical. And the thing that I think is so important for me to say to everyone, both here and on the live stream, is that you all are the key to that happening. If you're not sure what you want to do, if you haven't really made a decision, it's important for you to think about, I hope you'll think about this career field. If you're somebody who's a doer, I consider myself a doer. I like to get things done. I like to check things off the list. I like to make sure that people have what they need when they need them. If you're someone who enjoys doing that, if you care for others, if you love West Virginia and you want us to be well again, I encourage you to think about this field as a career path. As I said earlier, I've been in this field for 32 years. I don't regret one single day. Now, have there been some bumps along the way? Have I made mistakes along the way? Have I learned hard lessons along the way? Absolutely. I think that anyone in the field, when you're dealing with people's lives and working in the field that we work in, you're going to come across some really complicated circumstances. And I can tell you that even through all of that, I've loved every minute of it, and I wouldn't trade it for anything. I've worked in residential treatment up near Philadelphia with adolescents. I've worked for a Native American tribe. I've worked in public school systems. I've been an adjunct professor for several years now with the Graduate School of Social Work for WVU. And I've loved every minute of all of those different things that I've been able to do. One of the things that I want to note too is that the people that you work with, I don't think there's any greater sense of job satisfaction than to know that the people that you're surrounded with in your work environment are as committed as you are to serving and seeing others do well and prosper. And I can tell you that throughout my career, and I have contacts and people that I still talk to who were with me in the very beginning of my career 32 years ago. I stay in touch with those folks, and there's no greater feeling, though, than to know that camaraderie and that persistence to do and make things better and to leave things better than you found them. And so I say to you that that's another asset and another benefit of this work. If you're uncertain what direction to take in your career, I do encourage you to think about this path. There are so many different pathways that you can go. Clinical work, administrative work. I mean, there's just so many different things that you can do in this work. In my current position, I've done a lot of policy work over the last 8 years. If you enjoy the legislative process or you're interested in how policies are developed and how they impact people and how to go about changing those things, this is a really important way to do that. And I wasn't nearly as familiar with it as I am now. I'm pretty intimately familiar with it now, I have to say, but sometimes more than I would care to be. But I would say to you that I've watched some phenomenal things happen over the last 8 years, things that I never thought possible in terms of changing policy and developing new policies that have dramatically changed the trajectory of our mental health and substance abuse system and the way we conduct business in West Virginia. Our Bureau team has continued to persevere and embrace the changes and improve services and access, and we're going to continue to do that. We have an amazing team there and also a partnership throughout the West Virginia Department of Health and Human Resources that is phenomenal in terms of the group that works together. We also have several strategic partnerships with different associations and different schools and universities and different agencies across the state. And I think it is those key collaborations that really allow us to be successful. People who know me know that one of the things that I preach is collaboration. I don't think there's anything that you can do that you do alone. And that's another benefit of this field is being able to work with people and to grow ideas and to be creative and to think out of the box and to figure out what the solutions are and come up with the new things or use something that someone else has used and make it better. And I think that that's all possible with what we do. One of the things I wanted to say before I step away and turn the mic over is if you are interested and you want to learn more or you're somebody who wants to ask some direct questions, I know I'm myself and anyone in our Bureau would be more than happy to field questions at any time. You can call our office, and if you need that contact information, you can certainly follow up with the folks that have organized this event here today, either locally at your remote location or here today. We'll be on hand. So please let us know. Sometimes people don't want to ask things publicly or they want to just have a one-on-one conversation, and we're happy to do that. Some of us, that's how we got in the field to begin with as well. So again, I want to thank everyone who worked together to put this event on today. It's such an important one for West Virginia, and I hope that it's a huge success. I hope those of you who are watching remotely are enjoying this. I know there are some other activities on some of the other campuses in accordance with this event, and I hope those events go well. And I thank you so much. I'm very proud to be a social worker and be part of the team that helped assemble this event today. Thank you all very much.
Thank you, Kim. And I have to say, having known and worked with Kim over the past 9 years, she has certainly been an advocate for everything that we do out in the field. And I've always appreciated her openness as well as Vicky's. last but certainly not least, our host today, Marshall University, Gail Ormiston, who is the provost here. I have to say, when West Virginia was awarded this, Marshall stepped forward right away. We had some inroads here with Bob Hansen and Amy, so we really appreciate that, and it's been a pleasure. Being from the northern part of this state and being a WVU graduate, I realize those are terrible words to speak within these hallowed halls, but but I have 3 nieces that graduated from here. So, but anyway, I'd really like to take this opportunity to personally thank Marshall and to introduce Gail Ormiston.
Good morning. On behalf of Marshall University President Dr. Jerome Gilbert and the entire Marshall community, it's my pleasure to welcome you as the Substance Abuse and Mental Health Disorders Workforce Forum to Marshall University today. And I want to thank Amy Saunders for her great work in helping organize this and bring attention to Marshall in this regard. Marshall is committed, I'll break that, to helping its immediate community and the state of West Virginia find solutions to a variety of behavioral health and addiction problems. The opioid epidemic is currently the most pressing, but not the only one. Thus, addressing our behavioral health and addiction therapist workforce shortage is a top priority not only for the state, but for the university. Marshall's behavioral health departments, social work, counseling, school psychology, and psychology, all of which we have degree programs in, are committed to improving people's lives by teaching individuals, children and adults, and families how to cope with and to address the issues and problems such as mental health, substance abuse, trauma that affect their lives directly. Marshall's programs are committed not only to teaching clinical skills to help improve the social functioning of our community members, but also to conducting research to address the needs and find best practice solutions. Behavioral health occupations are among the most employable professions in the nation at this time. The employment rate for clinical psychologists and social workers is consistently over 95%. West Virginia experiences shortage in expertise in clinical research areas, making the need for employment, and particularly in those areas eligible for loan repayment programs such as the HRSA's National Health Service Corps. It is well known that the opiate crisis is symptomatic of a larger, strongly deeper social and behavior issues that we've not been able to address fully across our communities. Behavioral health practitioners are uniquely prepared to build both prevention and intervention programs to address these issues. Depression, anxiety, suicide rates, alcohol and substance abuse rates, and domestic violence in West Virginia are about the national average. Behavioral health professionals will be uniquely situated to address these problems and find solutions. If you'd like to find out more information about our programs related to these problems, you can go to our website at marshall.edu/academic affairs, and you'll find all the information you need. Marshall is very happy to lead this discussion and demonstrate how its academic interests provide the functional basis for interrupting the current path on which so many substance abuse and mental health disorders are set socially. I wish you a great day, and I hope you have a great time with us. Thank you.
Thank you, Gail. And again, really appreciate Marshall stepping forward and hosting what we're doing today. Okay, going to move on to our next section. I want to thank all of our greeters, and we certainly couldn't do it without the support of all of these individuals. Okay, next on our lineup, Cynthia, and I'll introduce some folks here, and then okay, when it comes to talking about folks that have an impact on the lives of individuals with substance use disorders, both nationally and internationally, you can't speak about that unless you speak about Cynthia Moreno-Tui, the Executive Director of NAADAC, the Association for Addiction Professionals. I've known Cynthia 30-odd years. We've worked together in a variety of different capacities over those years, everything from advocacy to certification, development of training programs. We've traveled nationally and internationally, and have had the opportunity to do lots of good work together. And anybody that's been around Cynthia longer than 5 minutes knows that she is a woman of passion, great insight and ability. She's a published author. She is committed. I'm kind of her boss now, being the president of NAADAC, and it's not unusual to get an email or a text at 3 a.m. I don't know if she forgets where she's at or forgets where I'm at 3 a.m. Usually I know where I'm at, but she's tireless, and we certainly get our bang for our buck in terms of what we pay her. It's not about pay for Cynthia. It's about passion. So it is a great privilege. And I have to tell you, she did this same thing yesterday in Columbus, Ohio. She and Heidi Ann drove here through the night to get here so that we could host this forum today. So I want to introduce to you Cynthia Marina Tui, the Executive Director of NAADAC.
Okay. Hi. Good morning. How are we doing today? Good? Participation is always lovely, isn't it? Because it gives you a chance to express. So this is the time to express. Jerry said a lot of nice things. They're not all true. Some of it is, unfortunately, true. So I think the thing I'd like to start off with before I call Patrice up is to really thank the West Virginia Commissioner Victoria Jones. She carries a passion as well for the people in West Virginia, not just around addiction disorders, but other human service disorders. So thank you, Victoria. That was a wonderful thing, a wonderful presentation that you made. She has put 32 years of energy into this state, and you can see that she carries that passion every day. And I think that's important, to be passionate and to care about what you do to make a difference. I think that's vital. And Kim Walsh, I had the opportunity to meet Kim, years ago, I think at a NAADAC conference, and she also carries that passion. I'm sorry we're going to be losing her to West Virginia, but we're going to congratulate her on her new venture. And Gail Orbitson, thank you for coming forward to agree to host this event here at the university. It is true that collaboration is the way to succeed, not just as a student, but in your professional life, you will learn that collaboration is the key. None of us can do this work alone. None of us have all of the skills and opportunities, and together we do build those other skills and opportunities and fill in the gap for each other. And I've noticed that in my years working in this profession as well. What can I say about the planning committee? They're the ones who really helped put this work together today, and we're excited that this is coming together today. We're also excited that we have the 8 satellite schools, and so we want to thank you all for participating with us and being part of this event today. And Jerry Schmidt, well, he is my boss now. However, more importantly, he is my colleague. And we have traveled the world together, and NAADAC has expanded its horizons in over 40 countries, bringing the hope of addiction practice to other countries as well as throughout the United States. And we'll talk some more about why that's important for workforce here in the U.S. And I would like to thank Patrice for being here today. Patrice Pooler is our president for our affiliate. NAADAC has affiliates in most states around the United States. And Patrice is our person here in West Virginia. She too is a dedicated, passionate person. And when people say, that we're committed. The other piece of that is, are we committed or are we committable? That is the question. That is the question. So I won't answer that. I'll let Patrice come up and give you what she has to say and see how she answers that. Patrice.
Well, the short answer is the verdict's not out yet. So as Cynthia said, my name is Patrice Pooler, and I'm I'm the West Virginia Association of Drug and Alcohol Counselors president, and I'm also in my real life, my second life, I guess, the executive director of Mid-Ohio Valley Fellowship Home. We are residential programming, five programs in Parkersburg, West Virginia, where people come to help loosen the grips of addictions in their lives. And we serve men, women with children, and men with children also. I've been in the addictions field for 22 years, and I have to say that this is the most sacred journey that I've ever been on, and I couldn't think of another journey to be on. So when I had the opportunity to come and talk to you about this journey, I was like, yes, for sure. I'm a little nervous, I'll just share that, but making a difference is really important to me. That was something that I wanted to do. When I was at your age trying to figure out what I wanted to be when I grew up, and actually I'm still asking that question 22 years later, but I really had decided that I wanted to make a difference in people's lives, because people had made a difference in my life growing up. I didn't grow up with the American Pie dream family, and so walking into the substance abuse field was just a natural connection for me. And so to be in the substance abuse career, we're looking for people that are compassionate and care about others, somebody that's willing to tell clients that it's not too late to turn your life around, whether you're 18 or 14 or 75. It takes education, dedication, and empathy to help others. And it's about an incredible sacred journey of taking a client from coming from rock bottom to a journey of healing and success. And I have to tell you that those miracles happen on a daily basis, and that's incredible. Like when you get to see somebody who's just so totally broken and nobody in their family wants to talk to them, nobody that knows them wants to have anything to do with them, and you get to the place where they're reunited. I have received hundreds of handshakes and hugs and just lots of gratitude from family members that have said thank you. Thank you for saving my life. Thank you for saving my son and daughter. Thank you for giving my mom and dad back. I haven't seen this child like this. She's 23, and I haven't seen her like this since she was 13. I mean, those are the countless things that happen in our field where people get turned around and lives are changed. We return happy childhoods, we save marriages, and we put people back on the planet to be the person they were born to be. And addiction had taken over and consumed them, and lots of times when they come to our facility, they're in a near-dead situation. They're totally broken spiritually, emotionally, and physically. And there's just no greater effort, in my opinion, than watching and being a part of that miracle. There's 20.8 million people nationally that meet the diagnostic criteria for substance abuse, and that's probably low, because not everybody that's an addict or an alcoholic says, hey, sign me up for that census. And it's also growing because of the epidemic status of everything that's going on in our nation. And within those 20.8 million that are documented, there are only 2.2 million, about 10.4%, that are actually have received treatment. So if you're looking for job security, the addictions profession, it definitely qualifies for that. There's currently over 95,000 addiction professionals nationally, and in the next 10 years, that's expected to grow by at least 22%, and again, those are probably low numbers. There's a national shortage, as others of the speakers have said, for trained addiction professionals, and which I find incredible because nationally this is such an epidemic status, and also at a state level we are among the highest rates of death from overdoses. So really, if you really want to make a difference in people's lives, and I was thinking, well, just a little bit about West Virginia, WVDAC we call ourselves, but the West Virginia Alcohol and Drug Council. We're the state affiliate of NAADAC, and we offer a network of addiction professionals. So once you get into the field, we can help you with that. We can help you for mentoring. We offer state-of-the-art educational pieces. We have legislative representation at local, state, and national levels. So you become part of a family who's interested in helping people heal and find the courage to heal. So I was thinking just briefly a job description, a little bit of some of the things that maybe would be good in the substance abuse field. And it would be somebody that likes people. If you don't like people, probably not the right field. Someone that actually has a passion for helping people heal and helping them find the courage to heal. A dedication to that process and trying to help people be the best people that they can be. You would need some empathy, and also education is helpful and advised, and constantly learning, as Jerry had mentioned, because the field changes and the needs of the clients change, and we as professionals have growth to do also with that process. You would want to be breathing, or you would want to be caring, but really the biggest criteria for this field is just really breathing oxygen. So if you're breathing oxygen and you have any of the other qualities that I've mentioned, you're perfect for this field. So again, miracles happen as a substance abuse profession, and I hope you're interested in being part of that. So your mission, should you choose to accept it, is to really look at what your life calling is. And if it's about making a difference in people's lives, then I strongly recommend that you consider this field. Thank you.
Thank you, Patrice. So now I'm going to talk a little bit about understanding the workforce implications for behavioral health providers. Just a quick overview, informational. So we know that under the Affordable Care Act that was passed in 2014, that we were going to serve at least 2 million more Americans under health care. And this continues to grow in terms of how many people have actually signed up under the ACA is over 10 million people at this point in time. What that caused is more of a demand for behavioral health professionals. Unfortunately, we don't have the professionals that we need. We're not equipped with the amount of people that we need to serve. And so we are doing more and more to find ways to extend the workforce, including training other professionals in addictive disorders. So in different states, there's different initiatives to help take other professionals like social workers, general counselors, and teach them the classes that are necessary to earn the competencies and the skills to become an addiction professional. I myself have been in the field for a long time, and over 40 years now. I started out as a student intern, a person in recovery, working on my bachelor's in social work. And I made a decision that I really wanted to do addiction, and at that time we didn't even use the word addiction. It was alcoholism. And then it was alcoholism and other drugs. And the reason why I came into this profession is I come from a family of addiction, and that of course affected my life. And I decided at a very young age, 15 and a half, that I wanted to work with people like me, kids like me, and families like mine. Because if nobody worked with those families, would they ever change? And of course, I only wanted to change the world. That's all. Simple request. And actually what happens is when you vision that and you work toward that, and I will say it's been a step-by-step process. It's not an overnight success. You, in fact, can change the world. And with NAADAC, I've had the opportunity with Jerry and many of my other colleagues to go to other countries and help change their process. That's an amazing honor. It's an amazing privilege to have that opportunity to work with others and share that hope of recovery and that hope of change. So I will say that this profession is, as Patrice said, one of the most rewarding things that you can do. So we know that the growth rate is high, 22%, between 2014 and 2024 that we'll need. And I agree with Patrice. It's probably larger than that. This is what they're projecting at this point in time. The salaries are low. And this is one of the areas that we need to work on, right, is income initiative. However, the salaries in 2015 average was close to 40,000. Just the year before, they were around 36,000. So what we're seeing is this increase in salaries as well. And I believe that as America and as legislators see the importance of this workforce, we're going to see that change. We're going to see more income coming in. And we're nationally working on that. How do we incentivize the workforce? How do we incentivize people to come into this workforce? And you can see marriage and family counselors averages 43,000 and social workers almost 46,000. So we're also seeing more and more addiction specialists becoming addiction specialists at the master's level. So this educational range is going to continue to grow. It's important to have a full continuum from peer recovery support to PhDs, and that there's certain scopes of practice that are done at each of those levels. So people can choose, well, I may want to start out as a peer recovery support specialist, and I may then get that bug that I want to do more, and I want to do more clinical work, so I decide to go back to school. Or maybe I have my bachelor's and I decide I want more clinical responsibility, or I want to do a private practice, or I want to be a clinical supervisor. And so I go back and I get my master's degree so that I can do that. And in some states, master's is required to do clinical work. So something to consider. So what are the issues that we're working on? Recruitment. That's why we're here today. We're working to recruit all the students that we can, and for you to go out and tell your fellow student or your fellow neighbor or the person in high school that's still trying to figure out what do I want to be when I grow up, to talk to them. Here's a profession that is growing. Here's a profession that's going to make a difference in the world, and would you like to learn more about it? Development is one of those important things that we do through NAADAC and through our affiliates. We develop professionals. As Patrice said, we network you, we build you, we raise you as professionals. And that is not a light thing, because many of us, as you have heard, come into this profession with some of our own baggage, right? And it's important that we're working on our stuff as we work with our clients, so that we're not behind them, that we're doing the work that we need to do internally to make that difference and to work through those issues. It also is a great role model for your clients. They see that, and they see that struggle, that you can struggle with this. You can enjoy the struggle. Does that make sense to you? Enjoy the struggle? Because some of us really know what that means, and many of us working with clients know what that means. And that's a positive thing. It's not a negative thing. So we work to develop, and then we work to retain. So it's important that we keep the workforce that we have and grow that workforce. And some of you who've been working in the profession, and I won't point to any of you in the room who've been doing this for a long time, we're not ready to lose you. We cannot lose you, right? Because we don't have the workforce yet, and we need that historical knowledge. And we also need that mentoring, that role modeling. And Jerry and I both mentor minority fellowship students who are now coming into their educational program at the master's level with a specificity in addiction. And we mentor them to not only continue with their studies, to think about where they want to work and what type of work they want to do, and what are their barriers in order to get there. So retention is a big issue. So we have developed now nationally a scholarship program, the Minority Fellowship Scholarship Program. Took 8 years of work to get through Congress, because other disciplines have minority fellowship money, social workers, mental health workers, physician assistants, dentists. All these other disciplines had minority fellowship money. Addiction did not have this money available to them. And so it took 8 years to convince Congress that we should also be seen as a discipline, and we should enjoy that money as well. Well, yay, we have that now. And for those of you who are going to move on to your master's at some point, please make sure you look into that. For those of you who are working on bachelor's, we're working at the federal level to get loan forgiveness or tuition support at the bachelor's level because we need that pipeline to be open. And we're working very hard to open up that pipeline with either tuition support or loan forgiveness programs. And some states are working at the state level on loan forgiveness programs as well. So our strategy is to promote the profession as a specialty. So it does take special skills, special competencies, and special attitudes. Because if you don't carry that compassion and that care, it's really hard to stay in this profession. You really need to carry that within yourself, that attitude of people are valuable, and people with addictive disorders and mental health disorders are valuable people. And they deserve to have the services that they need in order to become healthy. And we know that if individuals who have addictive and mental health disorders become healthy, their children have a higher chance of being healthy. Is that not true? So that's what we want. We want to build healthier families that each generation gets to that place. We also want to build a career ladder with equitable pay and equitable benefits. And so we're working on that every day at the NAADAC office in the Washington, D.C. area. And we collaborate with other disciplines to get there. As I said earlier, this whole work that we do is about collaboration. You cannot do it without collaboration. So under the banner of NAADAC, we hold national credentials, and our national credentials are accepted in every state across the country that recognizes those national credentials. They are the same in every state, so that is really important. It's very confusing in our workforce right now because we have so many acronyms that describe us. Do you know what a LADC is? Do you know what a CDC-1 is? A CCDC-3 is? An LCDC-2? An ACDC-3? I mean, it's confusing, right? How do we keep up with that? Insurance companies are not going to keep up with that. Insurance companies don't have to. Medicaid does not have to. And so one of the big initiatives is how do we actually get to national credentialing and getting more recognized by those companies. So one of the things that SAMHSA did is they did a survey through the United Behavioral Health Care Organization, which is the national organization for managed care corporations. And they did a survey of all the major disciplines, helping disciplines. And for addictive disorders, what they found is that the most reimbursed and recognized credential by insurance companies is the MAC, the Master's Addiction Counselor, that is run through NAADAC. And so we are really working to build that and the other national credentials as more highly reimbursed and nationally recognized. Student membership. So those of you that are students in here, we want you to join. We want you to get involved. We want you to know that we advocate not only at the national level, we advocate at the state level. The networking that you heard about from Patrice, mentorship. We offer all of these things, including student malpractice insurance. So one of the things we learned across the country is that some treatment centers won't allow someone to serve during their practicum without their own malpractice insurance. So we worked with an insurance company to be able to provide student malpractice insurance for $37 a year. Pretty inexpensive. I don't know how many lattes that is, but I come from Seattle, so everything is measured in how many lattes does that buy, how many do I have to give up. So tuition funding, we talked about the Minority Fellowship Program. We also have the William White Scholarships, and those you can find on the NAADAC website. And then we produce a magazine, you'll see it downstairs on the NAADAC table, that has articles not only from SAMHSA and NIDA, the latest research, also other promising practices that are happening so that you can stay abreast of what is occurring in the profession and what are the things to pay attention to. We have over 90 free continuing education hours available of information. If you're a student member or a regular member, all of the CEs themselves are free to you, but everybody can watch. So what's the road to the addiction profession? Well, it's getting started by getting involved with your local affiliate, learning how to network within that, ways that you can become involved. People don't believe me when I say that when I started getting involved with my state affiliate in Washington State, which is where I come from, I was the most bashful person you could imagine. You looked at me, I turned red. No kidding. Getting up on a platform like this and talking, forget about it. When my boss asked me to go speak to third graders when I first came into the profession, I said, oh no, I can't do that. Please don't make me do that. Don't make me talk. Don't make me talk to people. Not a group of people. I was so bashful. He said, oh no, you have to do it. I cried. So now I still get nervous. However, as Victoria and I were talking about, there's something about this profession that pushes you past your nervousness, that pushes you past your own sense of self into how important this work is and how important you are as part of this work. And so it pushes aside that little girl that gets fearful to talk in front of people, and it gives you that chance to provide your own passion about what it is that you do. So get involved. Join your local affiliate. Be involved. Be involved with NAADAC. We have national committees, national boards. Workforce forums like this is another way to get involved and get to meet people. And start that walk of learning more about your profession and your professional identity, because your identity will carry you through many, many situations and help you to grow internally and externally. So there's a lot of new areas of practice available now. So when I started out, there wasn't this huge field of possibilities. Now we have a very big field of possibilities. We have recovery support systems and ROS systems now, recovery-orientated systems of care. We have treatment readiness programs or pre-treatment, so helping people before they actually start treatment to begin to consider their change. We have an emerging aging adult population, so aging-specific programs are popping up. We have collegiate recovery centers, recovery high schools, and counseling centers or school-based counseling available. There's primary care or treatment provider liaisons helping people to connect with other things in their community. Specialty courts. You've heard about drug courts, family courts, veterans courts. There's all kinds of courts now to help people move into change. Medically assisted, medication-assisted treatment. At NAADAC, we like to call it medication-assisted treatment and recovery, because that is just another tool that can be added to your tool chest to help people begin that change process, the way that it affects the brain. Technology-based counseling and services, as well as clinical services. So we're going to see more telemedicine. We're going to see that grow, particularly in rural areas or areas where there's a lack of addiction professionals, so that people can get the services and the clinical supervision that they need. We're seeing more alumni services and monitoring services popping up, and that continuing care or post-treatment support. So what the research is showing is if a person stays connected, even if it's only monthly, with their treatment program for up to 5 years, a monthly booster session, that their chance for long-term recovery skyrockets. So we know that people need to be connected, and the more that they're connected, the more possibility for their recovery is. Clinical supervision and clinical leadership. This whole area is expanding as our nation is looking at what kind of clinical supervision standards do we need, and how do we help form those? And then to become a trainer or educator. Some of you in this room will be teachers. You'll decide to be a professor and teach addiction. Some of you will be teachers through NAADAC and train in different states and different countries. Some of you will do clinical and train, which frankly is my favorite, is to do clinical work, do administrative work, and train. I'm ADHD, I want to do everything, right? So while you're here, please take time to meet the exhibitors and learn, network, get to know them. NAADAC has workforce webinars coming soon, and this webinar will be posted on our website so that if you know other students who didn't have the opportunity to be here or to tie in, or those of you on our satellite sites, please let people know that the handouts and the PowerPoints will be available, and they can watch the webinar or share it with other people as well. And you're always, always welcome to visit NAADAC's website. We have a new website, a new look, so we're very fashionable. So please come look at us. I always say, follow your dreams. You know, whatever those dreams are, follow those dreams, because those dreams can become reality. I only wanted to change the world at 15 and a half. I only wanted to change the world. And Virginia Satir says, no, I'm sorry, it's Margaret Mead that says what? It only takes a small group of people to change the world. In fact, that's the only thing that ever has. So I really believe that any of you can be part of that dream to help change the world to become healthier and happier, and families to be more connected as a result of that. So thank you, too, for participating. And Jerry, I'm going to call you back to the podium for the provider panel. Also, please look at your packet. In your packet, you'll see the SAMHSA NAADAC career education ladder. You'll see the NAADAC initiatives. You'll see information from West Virginia as well. You'll see some information on scholarships and loans, and you'll see your agenda in case you want to know what we're doing today. So there's many things to look at in your packet.
Well, thank you, Cynthia. Thank you, Cynthia. Always enjoy listening to you talk about your passions. Just a couple quick things. Cynthia mentioned it briefly. Is we have vendors downstairs, exhibitors from different organizations and some of the different colleges here within the university. So there'll be time to network with them at the end of all of the presentations. So encourage you to do that. For those of you that are out there job seeking, this could be a good opportunity. So we have some providers from across the state. So would encourage you to do that. Also, I just want to recognize a couple things real quick. First of all, the breakfast this morning was provided by the West Virginia Association of Alcoholism Drug Abuse Counselors, as we like to call them, WAVADAC. So want to thank them for doing that. Lunch will be provided by the university. We want to thank them for that as well. While we're recognizing people, someone I don't want to overlook, because I think it speaks volumes to how you can get involved and how you can make a difference. Part of NAADAC's national structure is we're broken into regions nationally, and West Virginia is in what we call the Mid-Atlantic region, and the regional vice president for this region is none other than a West Virginian and someone that a lot of you may know, and that's Susan Coyer. And so West Virginia has a loud voice nationally, and I'm not saying that just because it's Susan, but that just happens to be true. But anyway, Susan's down at her exhibit table, so make sure you get the opportunity to stop by and see her. Okay, well, moving right along, and feel free at any point if you need to get up, go back and get something more to drink or eat. Please feel free to do that. Okay, so we've been talking about what it is that from a student perspective, if you're looking in at this profession rather than looking out, as a lot of us as providers are, what's out there? What types of services are available? Trust me, I've been at this almost 47 years. You will not be without a job. Okay, there's plenty of work out there. Any of us that are out there that have provider organizations, we're always looking for qualified providers for substance use disorders and for behavioral health in general. So some of the folks we have here today that are going to present from the provider side are going to talk to you about what it is they do within their particular organizations. I'm going to just introduce them, and then I'm going to let them talk more specifically about themselves and their organization. So, first person we have on the end here is Marie Beaver, who is the Executive Director of Ray of Hope. Next to her is Ashley Howe, who is the Director of Valley Healthcare System's Residential Substance Use Disorder Programs. Next to her is Dana Petroff from Prestera Center. She is the Director of Outpatient Services, Outpatient Addiction Services. And last but certainly not least is Tanika Phillips, who is with the Marshall University Counseling Center. And I'm going to let each of them talk specifically about their program, and we'll just go start with Marie and hand it off after you're finished to the next person.
Thank you. Thank you, and thank you for the opportunity to be here today. As Jerry said, I'm the Executive Director of Ray of Hope, which is a home for women in recovery from drug and alcohol addiction. We're located in Charleston. We have 4 properties, and we also have women with children. And it's been a process. The same way as the addiction field is a process, so has Ray of Hope been. We started with 1 building in 2005 with 10 beds. And the hope was to be able to provide a setting for women when they got out of treatment. And so after a couple of years, we realized that 10 beds were not nearly enough. And 6 months, which is our definition of success for them staying with us, was not nearly enough to clean up the wreckage of their past. So we partnered with some other agencies, and we purchased an apartment building because we thought, wouldn't it be awesome to have a totally alcohol and drug-free apartment complex for women and their children. And we were able to do that in 2008. Again, we maintained a waiting list, and in 2012 we expanded again and added 2 more additional facilities. So now we have 4, all in Charleston. Our mission is to provide safe, affordable housing for women in early recovery from drugs and alcohol, and to be able to provide a safe environment for their children. One of the things that was important to us was, and important for me too, was the fact that treatment is an invaluable service, and it gets people safe, it educates them, and it provides an opportunity for them to learn more about what they need to do. The sad news for many people is that if they don't have any choices, they go right back into the same environment that they came from. Some people are able to do well with that, but more often than not, more people are not. So we wanted to provide an opportunity for people to have a place to come to, not just to say, don't do this anymore, but to show them how to live without drugs and alcohol. So that's what Ray of Hope has been about. All of our women work full-time and pay their own way. We're about empowering them to be able to take care of themselves and to learn that they can do it for themselves. That's just a little bit about our program, how I got into this field, and the kind of staff that we have. We also model this behavior. You've heard other panelists up here talk about modeling this behavior. We hire a lot of our graduates from the program because who better to understand what it takes than the people that have just been through it. We have different levels of staff. Some of the graduates are more, we have night and weekend house techs, recovery coaches. If you haven't heard those terms about recovery coaches, you will. And so they're able to sit there and be more like peer recovery. We also have other staff and administration, like we're talking about, because it doesn't just happen. It's awesome to say, I want to help people, but then there's all these other things that have to happen so that you can pay for a place to have a place to help people. So sometimes you've heard us talk about dividing our services, our time between clinical work and administrative services. And fortunately, I get to do that on a daily basis, and it's wonderful because I get to make a difference, I feel like. And you've heard other people talk about making a difference. And the reason that I'm here today to be able to talk to you about this and to hopefully make a difference in somebody's life is because there was somebody just like you sitting out there one day that decided to go into this field that was there for me and made a difference in my life. And it's not unusual in this field for people to be in recovery themselves from some type of recovery. I'm in recovery for 32 years, and I've been working in the field for almost 31 years. And I didn't start out as a certified, master counselor or anything like that. I started out as, no certifications. I hadn't finished my bachelor's degree at that point, but I had a passion. I wanted to do something to help people that had helped me. And I was able to do that through, they hired me to be an aftercare counselor, and I called people to find out how they were doing after they left treatment. And that's how I kind of got my foot in the door. And then I was trained and I learned and I grew over years. And I have been able to work in every level of treatment since then. And now, like I said, it's mostly the sober living, which is a long term. I have to say that it's, a lot of times people will say, isn't that a depressing job? Especially with everything that's in the news today. And some days, there's a few minutes in the day sometimes that you think, what the heck am I doing this for? But 97% of the time, I don't know any jobs where you get to go to work every day that you get to see a miracle happen, or you get to see people physically change. They look different when they get it. And everybody that works in this field knows exactly what I'm talking about. But you don't get to do that in a lot of other jobs. I know that teachers, there's a lot of professions where you have hands-on, where you get to see people develop over a period of time. And I have to say, that's what I particularly like about where I am now, is that I work with women for 6 months, and then they can move into our apartments and stay for another 2 years. So I get to watch somebody's recovery over a period of time, sometimes for a year, 2 years, 2.5 years. And not only their recovery, but I get to see their family recover. I get to see them reunited with their children. And we start with supervised visits and have those children reunited with their moms and get to watch them grow as a family and help together. I've worked in, detox when you just have them for a few days, worked in inpatient treatment when you have them for a few weeks, and outpatient. So this is different because you feel like, well, I feel like it's really an opportunity to watch somebody through the whole process and to make significant changes. I've been able to watch people go through this program, decide they wanted to do this, go back to school, graduate from college, get certified in this field, and go to work in this field. And like I said, it's a process, not an event. And most people get into this because there's something in their life at some point that maybe they've had somebody they loved, or themselves, or they've known somebody, or they wanted to, be there to help somebody. And that's a wonderful reason to get into this field. That's what many of us have. Let's see. I'm going to pass this down, and when I think of something else, I'll grab the mic back. Everybody that knows me knows that I love to talk. But I'm really grateful to be here today, and I'm glad that we're addressing this issue, because a lot of us that have been in the field for a long time, we keep looking around and going, where's some more young people there? We need more people in this field, and we want people to come into this field. And it's an admirable profession, and like Patrice said, and several other people have said, if you want to make a difference, if you want to feel good about what you do when you go home in the evenings, it's a wonderful thing to do. To have people thank you and to love you for doing something. It's a lot like parenting, though, sometimes. They love you when you say yes, but they don't really like you sometimes when you say no, so you have to have like a thick skin for that, too. But all those things are things that you'll learn when you're in training and everything else. And we love having students. We've had several students that we've mentored in our program. If you want to learn more, we're always happy to share that or have you come for a tour or shadow a staff person to see if you're interested, if it's something you might enjoy doing. We're always welcome that. So I'm going to pass this on and let the next person.
Hello, I'm Ashley Howe, and I am representing Valley Healthcare System today. I'm currently the program manager of the Chemical Dependency Residential Services. Valley is a comprehensive health agency. We're nonprofit, and we are located in North Central West Virginia, with the corporate office in Morgantown, West Virginia. Valley does offer an array of services that include services for individuals with developmental disabilities, mental health issues, as well as chemical dependency issues. We have many sites, but the primary counties that Valley can be found in are Monongalia, Marion, Preston, and Taylor counties. I will be discussing the chemical dependency programs that Valley offers. Before I discuss my role and the two programs that I oversee, I would just like to touch on the outpatient services that Valley offers individuals struggling with substance abuse issues. So Valley offers traditional therapy sessions, intensive outpatient services, and of course our residential programs. Valley also has a crisis residential unit that provides services to those experiencing acute psychiatric symptoms, as well as providing detox services for those withdrawing from substances. So I currently oversee two programs, ACT Unit and the New Beginnings Extended Care Program for Women. I'm going to start with the ACT Unit, and the ACT Unit stands for Alpha Chemical Dependency Treatment Unit. The ACT Unit has a very interesting background. It was actually started in the early 80s, and this unit was one of the first residential programs for substance abuse in West Virginia. And the ACT Unit is one, if not the only program that is still standing. That was one of the first programs in the state. At ACT Unit, we do take clients from all over West Virginia, but we do give priority to those in our catchment area. Also, the individuals that have completed the Valley's detox at the CRU, we also give them priority too. So we get we do have a great referral base. We receive referrals from the CRU, the court systems, probation, parole offices, jail, and other detox and mental health agencies throughout the state, just to name a few. The unit is under the supervision of a licensed psychologist. We are not a medical facility at ACT Unit, meaning we do not have medical staff present at all times. We do have an LPN, and she is present primarily Monday through Friday. If the clients do come on medications, they would actually do the self-administration, and we have their medications locked up, and staff assist them with this process. So the LPN and the licensed psychologist are just some of the staff that play a vital role at ACT Unit. I'll discuss the different positions that we have available, but I'd like to first discuss actually what a client can expect when they're admitted to the ACT Unit. So at ACT Unit, we are a short-term residential program. The clients can stay up to 28 days, and almost all the clients that complete the program have stayed for the 28 days. So ACT Unit does receive block grant funding, and the client would arrive at the facility and they would have their intake completed and with the service coordinator and have their nursing assessment completed as well. And this is all on the first day, and this is just the beginning of their journey to recovery. The ACT Unit is very highly structured. As soon as a client is admitted into a program, they're assigned one of the two master level therapists that we have. So the therapist and the client begin to work on the client's discharge plan as soon as they're admitted. So as I stated, the ACT Unit has been around since the early 80s, and so much has changed in the way that we do treat addiction. In the past, addiction was treated as an acute illness, and what that means is it was thought that a client would go through detox or go through a residential program and that they should be healed after that. But now, after further research, we've learned that that's not the case. And it's actually been found best to treat addiction as a chronic disease and is also a very relapsable disease. And that is why the individual affected by addiction needs the continuum of care, the detox, the 28-day residential program, and then a long-term program such as New Beginnings. And my New Beginnings program is actually 6 months long, and after they complete that, we have referred them to Ray of Hope a large part of the time. So because we change how we treat addiction, this is why the therapists focus so much on setting up the aftercare plans as soon as the client is admitted. So the success rate of a client that completes a 28-day program and then does not follow it up with any other care, it's actually very low. They need to have that extra care after the 28 days. ACT Unit uses evidence-based treatment approaches for the disease of addiction. Cognitive behavioral therapy has been found to be one of the most effective approaches to treating the population. So I'll get back to the structure of our program, and like I said, we're very highly structured. And what I mean by that is the clients, they spend the majority of their day in groups with their therapist. They have a strict wake-up time, and they're assigned chores that they need to complete daily. And then attending groups is mandatory, and the only way that they can even be excused from any of the groups is by the LPN, and this has to be for medical reasons. Also at ACT Unit, we do provide random urine drug screen tests to assist with detecting any use of substances while the client is in treatment. ACT Unit also offers a very important group on Saturdays, and this is called the Family Education and Lecture. So what this is for our clients to be able to have a visitation with their support system. Their support system actually has to come and participate in this group. So this group is led by the ACT Unit therapist, and it not only educates the family and friends on the disease of addiction, but it allows the visitors to ask questions that they may have. So that's going to be somebody's mom, dad, grandma coming in that doesn't understand addiction, or they may not be aware that they are an enabler. So it's a very important group for everyone. By providing this platform for the visitors, this allows them to have a better understanding of the struggle that their loved one is enduring. ACT Unit also allows clients the opportunity to begin to build the foundation that is vital for a successful recovery process. Clients are also introduced to outside community resources, and what I mean by that is we actually leave the ACT Unit, and we attend some meetings such as Alcoholics Anonymous meetings, Narcotics Anonymous meetings, and Celebrate Recovery. So it's getting the clients out there, it's showing them the community resources, and showing them that they're not alone, that there's others out there that want to help them. So other than attending the off-site meetings in the evenings, our clients for 28 days do not leave the premises. So the therapists have a schedule that they follow to educate the clients on some of the more important topics in early recovery. So some of those topics that the clients are educated on are stages of change, stages of recovery, post-acute withdrawal syndrome, gratitude, forgiveness, guilt and shame, stress management, education on co-occurring disorders, cognitive distortions, and character defects. So those are just some of the more important topics that individuals in early recovery can begin to obtain a better understanding of when they're admitted to our unit. And so now I'll get to the positions, and we do have different levels of positions. For someone that has no degree or a bachelor's degree or a master's degree, we have a position for everyone. So there are actually 3 positions that are for non-degreed individuals. So those would be the support staff, residential assistants, and the recovery coach position. So the support staff just actually take on the secretarial duties of the unit. And our residential assistants, with anyone that is not sure if they want to go into the field or not, this would actually be a great position to start out and to see if you want to work in residential substance abuse. So they are actually responsible for assisting with the implementation of the therapeutic residential program. So that includes monitoring and documenting of the progress that the individual clients are making in treatment and ensuring that the rules of the program are being adhered to. And the last position that is for non-degreed individuals, and Marie touched on this too, is the recovery coach. And what is so unique about the recovery coach position is to actually be able to hold that position, the individual has to have shared life experience with the client. So more often than not, that means they've been through addiction, they've been through treatment, they know what it's like. So their role is to serve as a personal guide, a mentor, and a role model for the clients. Because when the clients come to ACT Unit, not only are they going to get the people that went to school to help treat them clinically, they're going to have someone that's been there and said, yeah, when I entered my 28-day, I felt like that too. So they have people that they can relate to on different levels. So the recovery coach, they also assist the clients in developing and maintaining this wellness recovery plan that the client and the recovery coach work on together to assist the client after they leave the program. So even after they complete the 28-day program, our recovery coaches are still in touch with them. And they just serve as an outreach, support, and do the recovery checkups once the client has completed the program. So those are the non-degreed positions, and then there are positions for a bachelor level person as well. So I have a residential specialist and service coordinator. The residential specialist participates in the treatment, the rehabilitation, and support services. The position has the role of carrying out the rehabilitation and support functions and assist in treatment, provides education, supportive services. So this is the position that's going to provide the supportive group and supportive individual sessions. So, and also the service coordinator performs the duties of screening the clients for admission, scheduling their intakes, assessments, treatment planning, IDTs, and participates in arranging the aftercare plans for the client. So for individuals seeking a master level position, there are actually 4 master level positions at the ACT unit. There's the 2 therapists, also a program supervisor position, and then my position, I'm a program manager. So the therapists, of course, are responsible for the assessing and planning and treating the behavioral health needs of the consumer and receiving community-based residential addiction services. And so the therapists lead the intensive group therapy sessions as well as the individual sessions. Now, the residential supervisor operates under the program manager, myself, and so residential supervisor and residential program manager, we're both over ACT Unit and New Beginnings. And we just oversee the daily operations of both programs, in short. So now I'm going to be discussing personally my favorite program. It's the New Beginnings program. And the New Beginnings program does mirror the ACT unit. There are the same positions for staff available, and it's just as structured as the ACT unit. And so the staff are still there assisting with managing the client's care 24 hours a day. New Beginnings is actually a 6-month-long program that specializes in extended residential care for adult females that are aged 18 and older. Unfortunately, at this time, we can't take any of their children, so it's just the women. So not only do these women carry the primary diagnosis of substance abuse, they more often than not also have psychiatric disorders. So the goal of New Beginnings is to develop and practice a recovery program that will foster the lady's ability to function independently in the community and in all areas of her life. So during the weekends, the clients are actually in the process of integrating back into the community. So weekends at New Beginnings are actually a time that they take passes with their sponsors or return to their homes. And participate in either a job that they hold in the community, or they'll actually go out and volunteer. So the females are being reintroduced to an independent lifestyle that is free of substances, but they're still in a structured transitional living setting that has the 24-hour staff supervision and the peer support. So the clients are also, the females are encouraged to participate in the 12-step fellowship program and daily meetings and obtain a sponsor that can assist them with their journey at New Beginnings. So New Beginnings and ACT Unit are just only two of the residential programs available to those suffering with addiction. So if you have any questions about them, I'd be more than happy to speak to you after this is over. But if you're thinking about a job in this field, it's very, very rewarding, especially with my New Beginnings program, when we keep the ladies for 6 months and then they come back a year later and they're holding some position, like an actual job and a career, and they come back and they just tell you how well they're doing and they thank you. My heart just melts, and it just makes me so happy to see that we were actually able to help someone and get them to where they're at. And it's very rewarding, and personally, I just really couldn't see myself working in any other field. So I will go ahead and pass this.
Hi, my name is Dana Petroff, and I am the Director of Addiction Services with Prestera Center. Prestera Center is one of the 13 comprehensive mental health centers around the state, and I am very proud to be a part of that team. I will briefly go over the services that we provide, but we are currently serving 9 different counties. We serve over 20,000 people a year, and we have a complete array of services that we can provide, very similar to what Ashley was just saying. We provide the intensive services. We provide co-occurring intensive services, which means that we serve both mental health and substance abuse clients in residential treatment and as outpatient services. We have children's services as well. We're lucky to have Prestera represented in the audience, and Mindy Thornton's our Children's Services Program Director, and she can provide services for substance abuse children that haven't reached the age of 18. So we're lucky. If you have any questions, you can ask Mindy about those. We provide from the very start. We have recovery coach services, just as Marie and Ashley have mentioned, clear up through our residential services. In Charleston, the Charleston area, we have a program called Maddie V. Lee, which is one of my very favorite programs, but it is a program that serves women and children. So as ladies are putting their lives back together, they can be reunited with their children, and the children can actually reside with their mothers as they're in treatment in the same facility. The children will go to school or to daycare, and the mothers will come to our clinical outpatient site and receive their group therapy, individual therapy, and all their services that they receive there. As a proud Marshall graduate, I am 2 times actually a social work degree and a counseling degree from Marshall. I am thrilled to be back here and to talk about this, but I want to talk about my experience just briefly as a perhaps a guide, because I think I was very lucky in this field. I was completing my BSW degree, and actually my professor is here in the room, and I was doing a practicum at a mental health center in Ohio, because I'm from Ohio, and I was so lucky to be offered a position prior to graduation, even offered the position, and when I graduated, I assumed a position at the mental health center as a case manager. And from that practicum and internship, I went ahead and worked through at the mental health center, completing my master's degree. So it is so important to Prestera and to other agencies that we reach out to students at all levels, bachelor's levels to master's level. We provide opportunities to learn, to observe, to get the skill set that you need when you get into the field. It's important for people to feel confident in their abilities, and that's a stepping stone to get there. I have my office is located in South Charleston, and recently I took students from 2 colleges, and they were bachelor's level, but they were completing their internship, and they approached me about an internship, and I said, I have positions open for bachelor's level case managers. Why don't we just go ahead and hire you for this position, and then you can get paid, complete your internship, and then perhaps be a master's level therapist for me. So they accepted that challenge. They completed their internship successfully. Wonderful, wonderful. And they then both magically turned into master's level therapists and got a huge pay increase. So there is a way to do this, and it is to get yourself out into the field, meet people. I see folks from the other comprehensive mental health centers. Logan Mingo is here from their area. Prestera is, again, in 9 counties. We've got Huntington represented, so we have folks here. I'm from Charleston, so the Charleston area is represented. Our substance abuse services cover the whole array, and Ashley did such a good job. I'm not going to beat a dead horse and go back over all that she did, but please use this as a stepping stone. I absolutely love my job, and that's we've talked about all the skills that people need, but what you need is a passion for this work. And I think that, you know, if you're in this room or you're watching today, you're well on your way. Thanks.
Good morning. I'm Tanika Phillips with the Marshall University Counseling Center. Our program is much smaller than what these ladies have discussed, but we reach a lot of students. The program is for students. We're in a unique position. I'm going to mention the dreaded word, insurance. But we're in a unique position that we aren't billing insurance. The services are provided from student fees, which really allows us to meet students where they are, clients where they are. I say students and clients interchangeably because everyone I see is a student. You have to be taking only one class to access these services. For me, that was a really unique opportunity because when I was in graduate school, I always understood we could just meet people where they were, give them what they need, but insurance doesn't always agree with that. So for me, it's been a really good opportunity because we can also do a lot of proactive work versus the reactive, so we can do a lot of preventative work. We offer crisis services for our students 24/7, so there are 5 full-time counselors in our office, and we are on call a week at a time, so every 5th week there's a counselor on call. We have the walk-in clinic, but we meet with students with all different mental health concerns and/or diagnoses. I say and/or because they don't have to have a diagnosis. As I said, we aren't billing, so there doesn't have to actually be a diagnosis. We can get out in front of some of the stress that they're experiencing rather than allowing it to become something much bigger. Prior to coming to Marshall, and I wanted to share just a little bit of my journey because I imagine and what I've experienced in talking to other people, it's not, everyone in this field didn't just end up in their dream job right away. I actually, after grad school, was one of the many people, I still hear people say this, I'm sure people in this room have heard people say, I'm leaving West Virginia as soon as, I'm moving, as soon as I finish school. If you haven't heard anyone say that, then I'm really surprised. I was one of those people, and then I left for a year after graduating from Marshall with my bachelor's, left for a year to come back to graduate school and said, I'm only going to graduate school and then I'm moving again. There's something about West Virginia, maybe something about Marshall that keeps pulling me back since I'm now working here, going on 5 years. But I don't regret it at all. I think we're in a great place to work for change here, and that's really what this field is about. It's not about keeping people where they are. There's so many opportunities to work for change in West Virginia. So I really feel very honored to be a part of this work in West Virginia. And working at Marshall, I've also had a unique opportunity to be a part of a staff that supports what may be seen as some unique ideas that I have. I like to be able to provide students and clients that I see with tools that they can use beyond beyond the traditional talk therapy or medication, things they can use on their own. Yoga is a big part of what I do. It started with my own experience with yoga, and it seemed like something that I should share with my clients. And from that, it's provided a lot of opportunities. I've been trained in life force yoga that focuses on mood management. So often when I use this in my practice, students don't even understand that they're doing yoga because you mention yoga and they're like, I can't do a handstand. Well, neither can I. But I will say, let's do this breathing practice if they come in and they're visibly anxious. That's a huge part of yoga. From that training, I went on to become a certified yoga instructor. So it's provided a lot of opportunity to present workshops on campus, to really meet students, like I said, where they are, which means sometimes not meeting with them in a counseling office. With yoga, I've also been trained in Y12SR, which goes along with more of the addiction side that these ladies have discussed. It's the yoga of 12 steps of recovery. I won't give you a ton of information about that, but it's not meant to replace 12-step meetings. It's meant to be an adjunct to that. The premise of Y12SR is the issues live in our tissues. For most people dealing with trauma and or addiction, we're not present in our bodies. So yoga is about being fully present in our bodies. That's the idea of Y12SR, of getting people to comfortably live in their bodies without numbing and escaping. And Marshall is also supporting my efforts I'm currently in the midst of getting trained in EMDR, eye movement desensitization and reprocessing. So halfway through that training, can provide that service now to our students. But it's really been a nice opportunity, like I said, to explore different areas of interest. And I bring up those different areas of interest because I recall thinking once I finished grad school in 2010, I was done. I just needed to get licensed. But the learning doesn't stop there. You continue to see new needs. You continue to see ways to approach those needs. And I think being willing to explore those learning opportunities, you can meet some great people. Sometimes can be a little bit of a rabbit hole because if you're someone who overcommits like myself, then you're like, yeah, I'll be a part of that. I'll be a part of that. But it's a great way there are great ways to continue to learn beyond graduate school or college, or whatever program that you do. And I think just having a willingness to do that, I think we all know people in this field are not in it for the money. So your passion will continue to lead you to those opportunities. And don't give up on the field. Was sharing some of my own personal experience, just don't give up on the field because you land in a job that's not a good fit for you. I had that happen between undergrad and graduate school, which made me question human services altogether. And so I took an insurance job. I lasted there 3 months. And here I am back. And from that, it was an eye-opening experience for me and this is why I will tell students exploring whatever careers of interest, don't just explore that one. Shadow many different people, because if that person has a negative attitude about their job, you're probably going to pick up on that. And also what one counselor does or one social worker does, we've heard from numerous people, everyone's doing different work. So explore all of those different jobs and don't let that one maybe mismanaged place give you a bad taste in your mouth that makes you think, oh, I'm not right for this field. Because I did end up back in the field very quickly, and I don't regret it at all. There are days that you're like, why am I doing this? But fortunately, those moments don't last very long, and you have those people that you see. In my situation, we see people who are really at some of their lowest points, go on to graduate college and go on to do great things with their lives, potentially going into this field. So just keeping that in mind, that there are a lot of job opportunities out there. Don't get discouraged by maybe one job that's not a good fit for you. I've had all different experience. I've been in residential, a psychiatric hospital, in-home, and now I'm on a college campus. So,
Yeah. Oh.
I knew I'd think of one more thing to say, Jerry, sorry. No, everybody was saying, I wanted to tell you how my day started today. When I was on the way here, and I went through a drive-through, because I didn't know you were going to have this awesome breakfast. And the person, I got up there to get it, and they stuck their head out the window to hand me my bag, and they're like, "Oh, Marie!" And it was a past resident, and I said, "How are you doing?" And they said, "I'm doing great. I bet 17 minutes clean. I love you." And as I drove off, and I thought, how many people get to start their day that way at the drive-through? So, and I just wanted to say too, we talked about a lot of things about mentors, and I mean that's what helped me in the field, and how much I learned from others and watching others what to do and what kind of not to do. But it's a wonderful profession. And it's what you make it, just like anything else in life. It's going to be what you make it. If you love what you do, you're going to be happy no matter where you are, what level you're in. And you take what you need and the good and leave the rest. So thank you.
Don't go anywhere. Don't go anywhere. No. First of all, I want to thank each and every one of you for taking the time out of busy schedules to be here, but we also want to take advantage of picking your brain a little bit. If we have some questions from folks that are out there, particularly students that might want to know a little bit more about a particular area, we're going to open up the mic for them. Something, too, you might notice is this is a female-laden profession. It is. I mean, if you look at it nationally, it's the numbers outweigh. I mean, you've got folks like Bob Hansen and I, and Joe Deegan, but we're in the minority here. So come on, guys, help us out. Anyway, do we have any questions from anyone that they'd like to ask any of the speakers that we have up here?
Actually, I can give you guys a question.
Okay.
You've talked about your opportunities. You've talked about your passion. Can you talk a little bit about barriers to hiring when you're interviewing people?
Well, I'll just say that one barrier, and it's the legislature's trying to do something about it right now, is second chance law, because a lot of people in recovery, they're going back and getting their educations and want to work in this field, have a colorful past, and it's prevented them. I know of people that have gone back and gotten degrees in social work, been inducted to the National Honor Society and everything else, but they have a felony in their background and they can never get their license. So that's one barrier for people in this field in particular that I was just thinking I want to share.
On the flip side of that, what I'd like to talk about is the opportunities. So if you're a student, Prestera and these other places want students. So if you're a full-time student, we will work around your schedule. We have direct care positions that will adapt to, I have a son in college, and so his work schedule is adapted around his school schedule. So we really want to reinforce that you can have the opportunity, if you're doing a part-time job, that McDonald's or Wendy's is an option, but also you could go ahead and get your feet wet in this field. So it's really a great opportunity that we would want people to consider us.
And actually, I think in talking in regards to finding a job, I know for myself, a barrier when I was looking for a job with my bachelor's degree, my biggest mistake in undergrad was I didn't network at all. So I graduated with a degree in sociology, and I didn't know anything about Valley or another mental health facility. So I sat with my degree for about a year and a half and didn't know what to do. So if you're in college, I would take advantage of things like this because, yes, because that was a huge barrier just for myself.
I'm not.
Is it work? Yeah. Okay. I'm not sure if any of you can answer this, but maybe someone here can. I'm a school psychology student getting my education specialist degree, and I already have my master's in psychology, but I would like to get a certificate or something additional in substance abuse so that I can work with substance use. I apologize, but so that I can work with adolescents who are at risk for substance use or who have parents that have went through that. So are any of you aware of any programs?
No, well, I was just going to say, I mean, we have the NAADAC and WAVADAC, and then we have Ronnie's here representing well, not representing, but she's on the certification board for the state of West Virginia I was going to say, let her.
Even though Ronnie's going to get up in a little bit and talk, might as well answer your question while we're live.
The West Virginia Certification Board for Addiction and Prevention Professionals certifies people at all different levels, starting with peer recovery support specialist and going through the top level credentials. And I'll talk about that in a little while, but the answer is yes. There are certificates you can get.
Okay, thank you.
I have a question for you ladies. What opportunities do you offer for volunteering? Like right now, we're both in graduate school and we're looking for volunteering opportunities specifically in addiction and helping like children and their families.
I'm sorry, the last part of that was about children? Well, certainly Prestera has lots of opportunities for folks to volunteer. We actually have our children's director in the audience, and I'd like to turn the mic over to her and let her speak to that.
Sometimes it's working with our clients, and sometimes it's not working with our clients, but we do have opportunities because we always need help in some way, shape, or form.
Thank you.
One of the things that we've seen, because we have women and children and we have them for an extended period of time, and the women are working and in a very structured days and evenings, but they still need to go to their self-help meetings in order to stay in recovery. And so they're working during the day and they have to go to their meetings at night. So we have had a lot of success with different groups in our area that have come in and provide babysitting in the evening on site for the women to be able to go to their meetings so that they don't have to take the kids with them and they don't have to miss their bed. It's just a lot of stuff involved. So that's been a big help for us and a big help for the women, is just to have a safe place to leave their children while they are able to continue with their recovery.
A minute ago, somebody mentioned something about a felony being a barrier. And I'm just curious, do you see that barrier reducing itself, considering people who are in addiction get involved in a criminal lifestyle? A lot of them are incarcerated. They come out felons. These people need employment. So do you see that barrier reducing itself or becoming more stiff?
I just know about the second chance law that I don't know exactly what all has been accomplished with that, but I know that they're, working on that to give people, certain felons, not everybody, but certain different crimes and stuff, another opportunity to not be held against them on their job applications and things like that. I know that it prevents some people in some place where you have to get licensed or credentialed, not necessarily credentialed, but licensed, if you have a felony. But like in our agency, when we don't have people with those kind of credentials, we take all that stuff into consideration when we hire people, because we have a lot of people in recovery, and unfortunately, sometimes that's part of it. So it's not that you're never going to get a job if you have a felony and you're in recovery, if you can demonstrate that you're, doing well and you're working towards, doing something better. Now, if it just happened like last week, we probably wouldn't hire you. But, if it's been a couple of years and you can demonstrate that you're on the road to recovery and not continuing in that behavior, then we're willing to give you another chance.
I want to touch it just a little bit about a program that we have that's spreading throughout the state. It's called LEAD, Law Enforcement Assisted Diversion Program. And what this does is it is a preemptive act so that folks don't get the felonies on their records. And so it's a partnership. And again, I'm from the Charleston area, so in our program, we have law enforcement officers that will contact me directly, and we will get them immediately into treatment to prevent that. So as long as they are diverted into treatment and follow through, the charges aren't charged. And we've been extremely successful with this program, and again, it's spreading throughout the state. I've been to Parkersburg, Clarksburg, Logan, and the program has been in Charleston been extremely successful in helping to divert clients from going down that path. And one of the complaints that you hear is there are barriers to getting into treatment. I can't get in, I can't get a bed. But this program in particular offers immediate access to treatment and has been hugely successful, so I'm really proud of it.
You're going to hear about the various credentials that you can get in West Virginia, which reciprocate to 47 states, and I'll tell you about that. But I do want you to know, we do not ask if you have a felony record, and it's not don't ask, don't tell, we just don't ask, and it doesn't matter if you do, you can still get certified. Now, will various employers want to hire you? That's a separate question, but at least you can get certified. If we didn't certify people with felony records, we'd lose about half of the counselors, especially the people that originally went into the field, who are mostly alcoholics and drug addicts themselves. So you don't have to worry about that in terms of getting certified.
There are some national programs as well, and I don't know if they're being done in West Virginia in prison systems and correctional systems themselves, where they're teaching the people that are serving time in the institution how to be counselors. So by the time they come out, they already have their certification. They have their education, they have their certification, they have mentorship, and they have the opportunity to start over again. So California has a really good model for that. They put a lot of dollars into that, and what they have found is that it actually reduces stigma and negativity within the system itself, and then when people graduate out of the system, it gives more opportunity in community and gives other people the chance to see it can be done. You know, it can be done. So there are some national models that are pretty positive.
We also have a comment back here.
Yeah, yes, Joe Deegan from Thomas Hospital. When we tried to hire recovery coaches specifically, we really run into major problems with that felony charge. And there's this website through the Inspector General's office called West Virginia Cares. I'm not sure that it really means West Virginia Cares, but it was intended for long-term care providers and you know, to not go into nursing homes and have a person with a felony. I think AARP was a part of that legislation when it was started. And I don't know that the intent was to actually cross over into mental health professions and health care like substance abuse treatment, but right now that's the way that is being enforced. During the session, we went up to Tom Smith and met with him a couple times. He's the lawyer for the Senate Judiciary Committee, and he was willing to do some research about the intent of that law. So if other people, he asked me, he said, well, find what problems are people having? What are they being told? And so, you know, if other people here have experienced a problem going through and that West Virginia Cares website, I think it's up for interpretation, but it's going to take a concerted effort of some of us providers to actually, you know, make it so the legislature would maybe make a rule that permits, you know, go into that old legislation and separate out what was the intent of that legislation in order to make a different rule to counter, because no matter, even with the second chance legislation, that may expunge somebody's after 10 years, is what I understood. But, you know, we're dealing with people 2 to 3 years or 7 years out of felony, and we couldn't hire them. And so I'm willing, if there's people here who are willing to go to their, the personnel managers at your facilities to come up with, like, what are the reasons here, to kind of get a little concerted effort to actually go back to Tom Smith and say, here's what we're finding. Here's the reasons that this particular HR manager and this other one are having a problem, you know, because that's what I'm doing at Thomas Hospital with our HR manager. And I just think it's, the intent of that law is what's causing, a lot of problems for us right now. I don't know, have you experienced any of that, Dana, or?
We struggle with that as well, particularly with obviously our recovery coaches, and we employ so many in our community engagement specialists. We have struggled and we continue to struggle. We were really hopeful with this Second Chance Act and that would do some good. So we're still advocating as an agency.
All right, we have another comment.
My name is Mary Beth Smith. I'm from Prestera Center also. One of the great things about working in this field is that you have someone who comes in, and I'm going to stand up because I think students over there. I never wanted to work in addictions. I thought it was silly and dumb. Who wants to work with a bunch of people who don't care and don't want to do anything? And I can tell you today that it's the best job I've ever had. I've never had anything so rewarding. About 2 months ago, we had a guy who came through our 28-day residential program. He went through our detox. He went through our 28-day residential program. He went through detox, and then 28-day residential, and so on and so forth. Finally, he lands in the medication-assisted treatment program and did a phenomenal job, really enjoyed all of the structure that the program provided, was really taking it seriously, really applying the things that he learned. Well, about 2 months ago, he comes in and he's like, I want to give back. And I laughed, and I'm like, well, good luck with that. You know, I can't charge you separately because that's illegal and a little unethical. And he laughed. That was a joke, y'all. We can joke in addictions. So he said, no, I'm serious. I want a job here. I want to work here. And I said, you know, one of the barriers you're going to have is that you do have a felony. And he said, well, I want to try it. I want to see if I can get an interview. I said, okay. So he was interviewed. Everything went great. Passed a drug screen. That's a barrier. People passing a drug screen, even at the bachelor's level and the master's level. He comes back and he's like, I think it went really well. They want to hire me. And then he comes back the next day and says, I got a letter from West Virginia Cares saying that I need character references for my felony. I will tell you, one of the most rewarding things I have ever done in my career is to be able to write a letter for this man and say, I saw him at his worst, and I have now seen him now, and I trust him. I think he'll do a great job as a recovery coach. So those are some of the stories that maybe a lot of, because I know most of the experience with West Virginia Cares is that they say no and we go on. But it is amazing to be able to work with someone who was at their very lowest in their life and then to now want to come back and give back. You don't find that anywhere else. It's so rewarding. Now, again, there are days when you feel like I'm pulling my hair out and I'm probably on the wrong side of the desk providing services. But every day you can leave knowing that you've touched someone, and that's important to our communities.
Jerry, I guess I can talk a little bit about West Virginia Cares. My name is Mark Drennan. I'm the Executive Director for the West Virginia Behavioral Health Care Providers Association. Kind of to echo what Mary Beth was saying, it is a little bit of a difficulty to get through West Virginia Cares, but you can ask for a variance or a waiver for particular cases. And we go to bat for people on numerous occasions, but they want a packet of information. They want to be absolutely sure when they do that. Part of the rule also is a Medicaid rule. And so they're looking at not just West Virginia state code, they're also looking at Medicaid rules against prohibitions against hiring felons. So well, we can look at that and be happy to work with you, Joe, and go talk to Tom.
Good. Thank you, Mark. Appreciate that. Okay. One last question. Right here. This young lady here.
It's not a question. I just wanted to comment on where we were talking about the backgrounds. I'm a person in long-term recovery, and I'm also a graduate student. And what I've found is that was a fear of mine because I have a colored background. I like how she said that. And what I've done is I've got good references, and I kept, jobs that were not like high-paying jobs, but I built up my character. And with the background, I was able to receive my temporary social work license. But I had to get references. I had to work hard. And what I encourage people to do, the background means a lot, but there's tons of different jobs, so you may not be able to get where you choose to, but you can always get back and work in addictions, but you usually have to work really hard to get there. So I just keep that in mind, that I don't ever give up, and there's places out there that understand.
Okay, trying to stay on schedule. First of all, I want to thank the panel. Let's hear a round of applause for what they do. Thank you, ladies. What we're going to do now, we're trying to stay on schedule, but we've got to feed you. We're going to take 5 minutes because we're going to keep live streaming. I want to apologize to the folks that are out there at the other sites. We're going to take 5 minutes as we ask you to go back and pick up a box lunch and bring it back to your table. Then we're going to move on to the student panel. So 5 minutes. And then I'm going to bring Rebecca up, and she's going to make a couple comments regarding our planning committee. Rebecca? You can get up and go back and get your lunch now while Rebecca's talking. She's loud.
Thanks, Jerry. I just wanted to take a moment while folks are grabbing their lunches to say thank you so much to this Workforce Forum Planning Committee. You all worked really hard, and all your work is greatly appreciated. I also wanted to say special thank you to Amy Saunders here at Marshall for all her work getting this forum together. So the other folks on the planning committee have, some of them have been in this room, and then I hope that others are on site closer to home. So I'd just like to read the names out. We have here in the audience Ronnie Rittenhouse from the West Virginia Certification Board for Addiction and Prevention Professionals. Thank you, Ronnie. Earlier today, we had Mary Aldred Crouch. She's the president-elect of NAADAC. I believe she had to go and do all of the other work that she does. Brian Quigley is the assistant professor and medical director of psychiatry for WVU. Thank you so much. And Laura Boone, Director of Health Sciences Programs at the West Virginia Higher Education Policy Commission. Thank you so much, Laura. Mark Drennan, Executive Director, the West Virginia Behavioral Healthcare Providers Association. Thank you. Bob Hansen, Director of Addiction Studies here at Marshall. Thank you so much. We have Stephanie Maxwell, the Council Chair for the West Virginia Perinatal Partnership. Thank you so much for all that you do. Michael Pruitt is the Dean of the College of Health Professionals here at Marshall. Thank you. Jerry Schmidt, thank you so very much for working with us throughout this work that we've all done together. And again, he's the president of NAADAC. We're so happy that here in West Virginia, we are really represented at the national level. And as well, he's also the COO at Valley Healthcare. Kimberly Walsh, Deputy Commissioner, Programs and Policy for the West Virginia Bureau for Behavioral Health and Health Facilities. Thank you so much, Kim.
Melissa Wheeler, the Director of the Division of Rural Health and Recruitment at the Bureau for Public Health at West Virginia Department of Health and Human Resources. Thank you so much. And Karen Yost, the President and CEO of Prestera Center. Thank you so much, Karen, for all that you do. And again, I'm Rebecca Roth. I'm the Office Director for Policy Planning and Compliance at the West Virginia Bureau for Behavioral Health and Health Facilities. And please really do look to any of the committee members if you have any questions whatsoever. We really hope to build on this event and move forward and be able to address workforce issues together. So thank you, all of you in the room. Thank you to the Planning Committee, and thank you so much to everyone who is listening on the live stream.
Okay, thank you, Rebecca. If you haven't grabbed your lunch, we ask you to do it because we want to keep the flow going here as far as our next presentation. I also want to thank Cynthia and Heidi Ann Warner. Heidi Ann's the other redhead that's running around the room here doing some things. Heidi Ann is the backbone of pulling this all together, her and Jessica Gleason, who isn't here from NAADAC. Okay, our next panel is a student panel, and I believe hopefully they're all in the room. We have 4 people on the panel. Okay, you're going to have to give me the last name, Amy. Okay, first of all, we have Carrie Dean, who comes from school of psychology, and then we have Savannah Thomas from social work here at Marshall, and Matthew Engel, who is from Bridge Valley Community and Technical College. And last but certainly not least, we have Haley Baker, also from the School of Social Work. So what they're going to do is give you a brief overview of their life as a student and also on the wings of finishing up and moving out into the profession, hopefully. So I'm just going to hand the mic to Carrie, who's first on the list, okay?
Like he said, my name is Carrie Dean. A little background, I'm from Mingo County, West Virginia, which is at the very, very bottom of the state. I started off at one of our sites that is actually watching this today at the Southern West Virginia Community and Technical College. I did my first 2 years there. I finished off my undergrad here at Marshall. I got my master's in psychology at Marshall, and now I'm working on my doctorate for clinical psychology here at Marshall. A brief overview of the program. It's a 5-year program. I cringe a little every time I say that. The first year is very schoolwork based. The second year you're in a practicum at the Marshall Psychology Clinic here on campus. The third year you're in a community practicum. The fourth year you're in a rural practicum, which is outside of Huntington. And then the fifth year you match for internship, similar to med school residency. So being a student in this field is interesting. If you choose to go into this field, I would absolutely say you should love people. You don't always have to like people, but you should definitely have a general love for people in this field. The coursework is, I genuinely like the coursework. I like the varying experiences I get in this program. It's an all-inclusive type program. We're a generalist program, so I get exposure to anywhere from children to adults to geriatric populations. I'm trying to think of other things I should possibly say. Like I said, the schoolwork is very eclectic. It's very a wide variety of things. We learn all the different theories in the program and different ways to approach various concerns, especially addiction. So.
Thanks. My name is Matt Engel. I'm a student at Bridge Valley. I guess I'm a non-traditional student. I actually have a bachelor's degree, and I decided to go back to school. And what I can speak to is some of the folks here don't know this, but I'm familiar with them, and it was August of 2015, and I was in treatment once again for addiction, and it was one of Prestera's facilities, actually, and trying to figure out how I ended up there once again. What did I go do wrong? How did I get here? And me and a friend decided to apply for schools, and I spoke to them, and we decided, let's take a look at Bridge Valley, and they've got this psychiatric rehabilitation program with a focus on addiction, and I met some of the professors there and decided it was something I wanted to get into. As I go on and I think about the future, I'm looking at master's programs and giving back. I think the foundation of recovery is hope, and we've had a lot of the people on the panels here talk about their jobs and how excited they are to go to work, even on the bad days. They get to see miracles happen, and on some level, I see that too, among my friends and myself on certain days, not every day, that's for sure. But Bridge Valley is doing something unique for me. They're giving me a new idea on a career, a future, some hope, and I get to look forward. So I want to take this quick moment to say thank you, Dana, for being there. Prestera has been a great help to me and continues to do so. And I'm grateful for that, and my hopes are to continue my education and give back to something that's given me a whole lot. So, thanks.
My name is Savannah Thomas, and I am currently a graduate student in the Master's of Social Work program here at Marshall. It's the first year of the program. It's a brand new program, and so far it's been super awesome, an amazing experience. My undergrad I got from Marshall. I have my bachelor's in social work from here. So my master's program will only take a year, but if you have, a bachelor's degree in a related field like sociology or psychology, you can go on and get your master's in social work too, and that will take 2 years. I'm from Fayette County, West Virginia, and I'm currently doing my field placement at Life Strategies Counseling Services in Beckley, West Virginia, and it's a super awesome experience, and I love working in the field. At Life Strategies, we deal with people with anxiety, depression, addiction, grief, anything you can think of. And it's super awesome, and I really enjoy it a lot.
Hey, my name's Haley Baker. I'm in grad school here at Marshall as well. I'm in the 1-year social work master's level program. I have an associate's degree as a medical assistant. I have my social work bachelor's degree, and then me and Savannah will be finished in August, and I can't wait. I currently work with the Department of Health and Human Resources as a CPS worker, and I feel that our undergrad program here at Marshall it was amazing. Prepared me so well for my job. I have removed so many children due to drugs with their parents or grandparents. I have removed children due to overdoses, and that kind of made me want to go back to school so that I could have the higher level of education to be able to help those people further, not having to remove their children. It's been a struggle, but I learn from it every day, and I'm very glad that Marshall prepared me to be able to do my job.
You're not getting off this easy. What kind of questions would you have of students? This might be from the provider side, asking them, what would it take for you as a provider to attract them to your organization? What are you looking for?
Actually, I have a question. Patrice in her presentation earlier talked about a job, like the things that she's looking for in someone coming into the field. Can you guys describe what you're looking for when you are looking at potential employers?
I'm personally attracted to integrated healthcare. So facilities that really integrate medical doctors as well as psychologists with social work and counseling and everything to have a more holistic approach to addiction as well as other mental health disorders and treatment. So integrated healthcare, a good teamwork environment amongst the professionals, I would say.
I think for me, my hopes are to ultimately work in the hospital setting and possibly be a professor at Bridge Valley. That would probably be my dream job.
I would have to agree with what Carrie said. The integrated care model, I think, works the best. I think that when you have patients or clients who are jumping from one provider to the other and trying to pass along all the information about themselves, things easily get lost in the shuffle. And so I would like to work for a place that, you've got physicians, social workers, psychologists, nurses, whatever, working together to give people better value for their health care.
I agree with what they said with integrated care. I would like to eventually get to where I can work with the VA. I have a passion for working with the elderly as well as veterans, so that's where I would like to be.
Great. Any questions?
Hi. Tell me a little bit about what you think at a policy level that needs to change to help people dealing with addiction.
Can you repeat the question? I couldn't hear you. I'm sorry.
At a policy level, what do you think needs to change? What do you see in your work every day that you think needs to change to better address issues with addiction?
Well, specifically in the social work field, I've had a couple classes in policy, but I definitely think there needs to be a push to get mental health professionals who have a passion to work in that field and know how to talk to legislators and I guess have a passion for politics, to just have a presence, a better presence, at the Capitol and working in the communities. So I guess just maybe a push for more mental health professionals who have a passion for that to have a presence, period.
I know I said I'm from Mingo County. Mingo County is incredibly underserved as far as southern West Virginia. So my answer to that, and I don't know if this is a policy thing, but definitely pull in more funding for those counties, McDowell, Logan, Wyoming, Mingo. I was fortunate enough to attend the community forum with President Obama, so I was hoping something to come out of that as far as funding and policy-wise goes. I also think the second chance law is a great thing. But definitely helping with those underserved rural areas.
So some of us as employers would know, if you were writing the script or painting the canvas, what would your dream job look like?
I think I said earlier, it would certainly be a professor, and I think running group sessions at a hospital, being a graduate, I guess, of certain facilities. I'd like to give back and help. The problem with addiction is it just attacks every facet of our life. It's family, it's finances, it's employment. It comes in so many different ways, and yet it's recurring. And the success rate by the numbers are very low. Relapse is part of recovery, and we need to keep working towards helping people no matter what or how many times, and me being one of them. That's certainly my story. So I think instilling hope, and giving support that's continuous over time and lengthy time, not 6 months, not 1 year, but 2 years. And I forget what panel leader said it. If you keep coming back for months after that 5-year period, your chances for success increased incredibly. So I think it's long-term support is really the goal. And, in my dream job, that would be in being an educator and helping in a group setting at a hospital.
My dream job would definitely be working in the school system as a mental health therapist for children. I think the schools in West Virginia right now, as a whole, it's very sad how underserved our kids are. Like I said, I'm from Fayette County, and I currently live there, and I commute to class in South Charleston. And the schools in Fayette County are some of the worst in the state. And I think that, if we get people in there who know behaviors and understand child development and adolescent development, we can start to work with these kids to teach them the skills to help themselves instead of, suspending a bad kid and then they get a week off of school and then they come back and they do the same thing. So that would definitely be my passion, is working in the school system with children.
I already stated I really want to work at the VA and with veterans. If that would never be a possibility, because I know that they, once you get your foot in the door at the VA, you're probably going to stay and retire from there. Probably just one of the hospitals. Since I have the medical background somewhat already, I'd kind of like to continue there and just continue social work.
This is probably the hardest question I've ever been asked. There are so many things that I would like to stick my hand in. I know recently Marshall just hired an addiction specialist, and I think that would probably be my dream job, is being an addiction specialist housed at a university with a medical school, so I can really promote a more integrated model so that we are not just focusing on how the physicians can approach a treatment, but how is behavioral health and mental health, as we all know, play such a huge role in addiction. How can we bring that to the table as well with the various fields? So an addiction specialist that promotes a better integrated model.
Great. We did get a question on the live stream. Have you had any exposure or telehealth training or delivery services via telehealth?
I have not, outside of like a small webinar. That is about my extent of training with telehealth.
Yeah, I have it.
I haven't personally had experience with it, but I do know of one place in Beckley, Beckley Psychiatrics, who have clinical social workers who provide services a lot through telehealth, just because, we're a rural state, so a lot of people can't drive or get there. So I don't have experience in it, but, I have heard of it, so.
I don't have any experience with that either, so.
That's something that should be more included in education so that everyone's exposed to it.
I'm going to say yes, because I know, like, from me being from Lincoln County, I know that a lot of people struggle getting back and forth to primary care places, doctor's offices and things, and just even if they're involved in drug court and different things like that, or just trying to get to the courthouse to pay their taxes, transportation is a major issue. So I think that that would be something that, yeah, that would need to be.
Yes, absolutely. Obviously, it's not going to be as good as meeting with someone face to face, but it's what's realistic, especially in our area. So, yes, absolutely. I think there should be at least a little bit of training for students in it, just so they can be prepared.
It certainly seems to be part of the future, especially in rural communities, that we have to reach out to people any way we can.
Just kind of going off what they said, it's an up and coming thing, and it's kind of like the more you know.
Great. And we have another question that came in via live stream. Can you guys talk about how you see peer recovery specialists, recovery coaches working as part of the team with counselors and others?
I think that's absolutely a vital part in recovery, because so many times someone will look at you and say, well, if you've not gone through this, how could you possibly know how I feel? Or how do you know how I feel through a textbook? So having those people who have experienced this and also have the education as well on their side and in that team definitely gives a new perspective to the situation.
So I've worked with a recovery coach, and I have friends that are recovery coaches. It brings that connection that we're talking about, where if as addicts in recovery, we're grand manipulators and very smart and look for any way sort of to get what we want. So when you have a recovery coach in these settings, they can sort of see through any of the BS that might be going on. So I think it's a critical part of any of these facilities, and a good thing.
Yes, I certainly think that, recovery coaches are a wonderful thing. And like some of the providers talked about, a lot of the recovery coaches that they've hired have personal ties to the whole experience. And that's just something, building on rapport with a client, that you're going to be able to connect with them, more than someone else who doesn't personally know, other than, learning about it in school. Or even if they have, experience working with that, you still have, recovery coaches just have an advantage. And it's the same with, veterans in the VA. If you tell a veteran you're working with, oh yeah, well I served, you're automatically going to have more of a connection with them than, another person would who hadn't served. So it is what it is. But yes, I certainly think it's a wonderful thing and very much needed.
I think that it is good because pretty much everything that they said, you want somebody that's had that experience and can relate to the situation. Any questions from the audience?
Hi. Okay. This is kind of on topic, but I have to go to class, and I wanted to ask this before I had to leave. But I'm a little undergrad, and I just want to know, especially like with the peer recovery support specialist, like it says one of the career opportunities is like that's one of the career opportunities you can get with just a high school or GED. And I was wondering, like, how would you go about that, or like would it be beneficial, or who do I talk to, where do I talk to? Just can, like, anything with maybe not even internship because I'm still an undergrad, but what kind of work or volunteering or like the peer recovery support specialist titles help in undergrad for the future?
Do you want us to take that? Okay. Oh, hold on, let me get Ronnie.
It's not a professional credential, and you have to be in recovery yourself from something. It could be drugs, alcohol, depression, anxiety, some mental health or addiction-related problem that you're in recovery for. And then you can get that credential. But I want to make it clear, it's not a professional credential, so you wouldn't go from that, say, to an alcohol and drug counselor credential. But it's really a good thing. I'm going to talk about it in a little bit. It's really a great thing to do. And I'll talk in a little bit about how you can get it.
And we have another comment.
I just wanted to comment from that. What I would suggest, I started out, okay, we're going to go with 4 years ago. We'll say that I'm 20-ish. When I started out, I started working at with Children's Home Society as a child care worker. So I think working with any agency that provides direct care work for anything. When I will look at an application for someone that I'm wanting to hire with a bachelor's or even with a master's, I want to know what kind of experience they have related. I will tell you, and for any of you who know Mike News, who has since retired from Prestera Center, one of the things Mike said that he wanted to see in anybody that he worked with in the field was someone who had either worked in fast food, and by fast food he meant McDonald's, because you can multitask, it's high stress, it changes all of the time, or who wanted to see somebody who had either worked with people with addictions or with children. So I think gathering that kind of experience, and I guess just as a plug for Prestera Center, we are always hiring direct care staff. There's Kamak Children's Center, there's Presley Ridge, there's the Irma Bird with Children's Home Society. There's lots of different agencies in town that you can apply for a job with. And a lot of those, like Prestera, you can actually do your internship and be paid for your internship.
Thank you. We have another comment.
I was just wondering, what is your major right now? Psychology? Okay. Cool. I just wanted to say that, you know, if you're thinking, I mean, obviously with psychology, you're going to have more than undergrad, you know. But I would just like to say that, you know, if you're interested in working with people and being on the front line of working with people and helping people and understanding behaviors of people, social work is a fantastic field, and there are endless opportunities of what you can do with it. And I have never once regretted going into this field, so I just wanted to let you know that. It is an aspect of it, yes, certainly. But obviously, you know, I'm getting my master's in social work, so I am more for the social work side because I think there's a lot more that you can do with it. But that's great that you're minoring in counseling. That's really awesome.
Also, if you are wanting to work right now and work with kids and see kids that are trauma kids that have gone through, you know, any type of abuse and neglect, or if they have some behavioral issues and things like that, through my internship, I'm actually at Presley Ridge Grant Gardens, which is located in Ona. They're right past Cabell Midland High School. They are in desperate need of like direct care staff. Presley Ridge Grant Gardens.
I would just like to add too, if you're a Marshall student, we just started an undergraduate addiction minor, so it's a collaborative effort for students who are interested in different information. So we have about 10 different professionals working on that minor. So there's social work, counseling, we have history, public health, just a whole variety of people. English department, they're all working to work on that collaborative model towards an addiction minor. So that's starting off in the fall, so look for that.
Thank you. Hold on, we have one more.
Just one national perspective on peer recovery support. So this is a growing place for people to get involved. And in fact, NAADAC is working with Optum Health and United Behavioral Health to identify hotspots around the country where peer recovery support specialists are needed. And the hope as this grows is that a community or a state might say, okay, we have a need in this location, and we can then identify that and do a call, basically a call for people to serve. So there are going to be more national efforts in terms of looking at workforce and where workforce needs are. So there's always a place. Yeah, if you have a heart, there's always a place.
Thank you. Any other questions for our panel? Oh, we have one back here.
I'd like to know what you would like to see as far as clinical supervision and clinical development from your employer when you're hired.
Well, where I am at right now at Life Strategies Counseling Services in Beckley, Hamlet Smith is the director. He has his doctorate in social work and his master's and his undergrad. And exactly what I am getting from him is what I think everybody needs. He's just a great supervisor, and the things that I have learned working there, it's just so priceless and awesome. Definitely hands-on, honest. So I guess I would want someone who would be honest with me and call me out on something that I might not be doing so well, whether it's, the way I who knows, whatever. Just someone who's honest, because I think when someone is honest with you, that they truly care about your development, your professional development, and helping people to the best of your ability.
In the program that I'm in, we're heavily supervised. So I'm in the first level of practicum right now, which is the Marshall Psychology Clinic on campus. My supervision level at this point is really hands-on because this is my first time acting as a supervised clinician. The further I go throughout the program, the supervision will change because the practicum site will change. As far as post, I guess, licensure and post-internship, I think I would like a hands-off approach, but also like to be available if I'm having some difficulty really teasing out different diagnoses and things like that. So hands-off but available, if that makes sense.
Great, thank you. Other questions? Okay. We did talk earlier with our provider panel about barriers in hiring practice. What barriers do you guys feel are out there when looking for jobs?
For myself, I've never been in any legal trouble. So I know for some of my other friends that have gone back to school or become recovery coaches or tried, felony charges are a big one. We talked about second chance, and I certainly think it's a good thing. Some of the other barriers to employment, I think for myself and I think many others, it's the low pay. Starting out is difficult. When you talk about being a behavioral health technician, starting at $8, $9 an hour, when you can work someplace else for 10, it's sort of disheartening. It speaks to the importance of continuing your education. You're in any sort of, from what I see in my experience, in dealing with any mental health issues. Unless you've got higher degrees, you're really going to be on the lower end of the wage scale.
A particular barrier that I have experienced is whenever I graduated from undergrad and I had my bachelor's in social work, it was very hard to make myself stand out in a group of applicants because I didn't have any experience other than the practicums that I had done in undergrad, which was 500 hours. But that obviously, to an employer, that's not going to look as good as 5 years of experience. So, that was definitely a barrier. But after being in the master's program, my practicum experience has been a lot a lot more hands-on, and I feel like I am trusted more with things just because I am at a master's level. And so luckily I'm fortunate enough to where my supervisor is planning on hiring me whenever I graduate. So that's great. But definitely, you know, which it's understandable, employers want experience, but I don't know. I mean, if you interview someone and they really seem like they have a passion and they're a hard worker, I think that goes a long way, especially with, you know, people who have just graduated.
In the past, before I started the bachelor's level social work program here, I only had my associate's degree as a medical assistant. And I don't remember if I said this earlier, but I received my phlebotomy license. And around here, no one wants to hire you unless you have experience. So when like a month before I graduated from undergrad, I already had a job lined up with the state of West Virginia, and I'm not sure what will be the next path for me next. Hopefully something big. But having the prior experience is something that's been a problem. So.
Great, thank you. Now, I think we all know that just getting the education, going to school, is only one piece of the overall puzzle. Once you graduate, you have to, you know, find a job. But then there's licensure, additional accreditations, additional education. Talk about how important it is, or if it is important, to find an employer that will help support you, possibly give you reimbursement or support financially the path to licensure and additional education.
Well, again, I work for the state of West Virginia, and I know that they do reimburse for your licensure. You can come in with the social work background, the degree, and the licensure. It's very confusing. All of it is. If you don't have the social work background, it's so confusing for people. But I know that the state of West Virginia does reimburse for licensure, whether it's your provisional, restricted, temporary permit, whatever it may be, they do reimburse.
I think it's great when employers offer reimbursement for taking a licensure exam, but at the same time, I know that that's not always realistic. So, I mean, that's understandable. Where I'm at right now, at my practicum, it's a private practice, so he doesn't offer reimbursement. I mean, it is what it is. I guess it'll make me study harder so I don't fail because it's going to be my own money.
Certainly when I continue and look at master's programs and look for my next employer, that's going to weigh into it. If they're going to help support my education, that would certainly put them higher on my list of places that I'd want to go to.
I think that's absolutely important. I know with me, by the time I am entering postdoc, APA is talking about adding a second section onto the EPPP. So that will raise the price as well. So to find an employer that is going to reimburse me for the EPPP and possibly be willing to supervise me for my postdoc hours as well as let me work, that would be a dream as well.
Thank you. We have another question over here.
I have several cousins that are or have been addicted to drugs. And I'm in a completely separate field, MIS, and trying to go, I'm trying to go into respiratory care. But this summer I should have a minor in psychology. Is there something, because I hate seeing the drug addiction, and I have family that have gone through it, is there a way I could maybe help or lend a hand with drug addiction?
Hi, I would say here in Huntington, there's a lot of community efforts going on that you can get involved with and volunteer. Reach out to some of those organizations. You can give your information to me, and I'd be happy to share it. Recovery Points here, Her Place, they do a lot of great programs in the community with families, and those are great ways for people to get involved in the community who want to give back.
Anyone else? Okay, hold on.
The other thing I would say about that is you have your minor in psychology. So take some addiction courses, and then decide, do I want to move more into addiction? You have a passion for your family. You care about what's happening. You're a perfect candidate to be one of us. So I would say you're on the right track. You're at the right place, learning information. So take a couple addiction courses, see how that fits. And you can influence your family. You can't treat your family as much. You can influence them by your example and by reaching out to them with just droplets of information. I have a family system that's very addicted, and I've been working in the field for a long time. And sometimes it's those droplets that help of information. So you're non-judgmental. You're not pushing yourself on your family. However, you're giving them pieces of information that helps them to consider what's happening to my life. And with your compassion and your stability and consistency, that can make a huge difference in your family system.
I'd also like to add to that, support them. Help them as much as you can. Like if they just need help getting to the grocery store or something, just that little bit in the car ride and just talking to them. You don't have to talk to them about what drug that they might be using or their favorite kind of liquor or something like that. Just talk to them about how their day is going and just how they're doing. I know that that's something I've seen to help people, even if it's, they need help getting into a program somewhere or just going with them to like an NA meeting or an AA meeting. That's you spending time with them and showing that you support them. And that's something that a lot of people don't have. And, a lot of families, they turn their back on family members because of their addiction problems and things that might cause them to, they might get in trouble a lot. I've seen that. I have a family member that's the same way. They get in trouble a lot because of their addiction problems. I try not to turn my back on them as much as possible, and it's hard. And you have to also keep in mind that you can't give them everything. So even though you're trying to help them, don't let them take advantage of the situation at the same time, no matter how much you love them. And because that'll only make things worse. But just support them as much as you can and maybe push other family members to support them as well. I've learned that that's something that people need just in general.
Hi, as a family member of an addict and an alcoholic and also a person in long-term recovery, there's also a 12-step recovery called Al-Anon and also a 12-step recovery called Nar-Anon that would be very helpful for you and any other family members to both see the impact on how it's has affected you and is affecting you, and just to help the family grow and heal.
Thank you. We've had a few more questions come in on live stream. One of them is, do you believe that there are any barriers to employment regarding your level of education?
Yes, absolutely. For example, if I was not currently getting my master's in social work, then I wouldn't be able to do therapeutic counseling. I would be qualified to do counseling, but I would not be qualified to do therapy. And that also is based off of your licensure. But in social work, along with getting higher levels of a degree in social work, it opens up more doors to get higher levels of licensure, which, always in turn opens up a lot more opportunities. So in social work, yes.
Yeah, I think anything in this field, I'll have an associate's from Bridge Valley, and I'll have a degree from Northeastern University in journalism, and yet I'm still going to have to go look towards my master's to figure out, to get ahead and make really truly livable wage.
I know right now when we participate in Lobby Day, one of the big discussions is master's level psychologist licensure versus doctorate level psychologist licensure, especially in West Virginia. So that could propose a possible barrier with whatever you choose to do.
Great, thank you. And then we have one more question. I'm not if you guys can answer it, but it might be also for the rest of the group. What are some events coming up in the community that you know of promoting recovery and wellness? You guys, you know any? Does anyone in the room know of any? I was told to ask you two.
I'm trying to think.
All right. While you guys look, I have someone over here.
Well, this is a little bit of a left turn from the question, but you all might want to know that in June at Canaan State Park, NAADAC is hosting its annual conference. It's an addiction conference, and as students, you get a reduced rate. If you join NAADAC, which I think is a really smart move, it doesn't cost a lot, and the student rate there is greatly reduced, and then you get a lot of free training, not only online, but then you can go to the state conference for a reduced fee. So I think that's something that you all might want to think about. And you'll find that in this field, it is like coming home to go to that conference. You see a lot of people hugging here, multiply it by 10, and once you go once, you want to come back because it's so great.
I don't have exact dates, but I was a part of Overdose Awareness Day last year. It was in August at the state capitol, and that was a pretty powerful event. And at Bridge Valley, and again, I don't have dates, but the recovery walk, Walking for Recovery, and that's going to be, I believe, in May sometime.
Did you guys find some? Okay.
Sure. Coming up, through the summer, of course, in the Huntington area, there'll be car washes. I'm sure there'll be some more, picnic type deals. And so there are some Facebook groups. So if you're in the area, follow Recovery Point. They usually announce some events, and that's a good way to stay connected. But right now, we have on the books September 30th in Charleston, Recover the Beat Music Festival. And so we also will have our annual Embrace Hope Dinner. That'll be December the 8th, and so those are pretty far off.
Just to piggyback on what Ronnie said, that conference is June 6th and 7th, and it's at Canaan Valley Resort. And we have a website, www.wvaadc.com, where you can actually register. And also we have a table downstairs if you have any questions for us. There's also business cards. And Joe, raise your hand. He and I are both on the board, so you can ask any questions to us also. So thanks.
I was just going to say, there's a drug, I was trying to find it in my email, there's a drug forum that's getting ready to come up in Charleston in May, and it's with, do you know anything? I got this email, and it seems like it's like the DEA and some other things. They're having a big, do you know what I'm talking about? Anybody have any information? It's May, I want to say 11th, but I'm not, huh?
We're getting the dates.
So this is DEA 360 training. They are here doing a lot of different great things in the state with us. They're our partners, and they are getting ready to launch some prevention training, and these are the dates if anybody would like to come. So Kanawha County will be May the 4th from 9:30 to 12 at South St. Paul United Methodist Church. Putnam County will be May the 4th from 2:30 to 5 at Tays Valley Church of God. And Cabell County will be May the 5th from 9:30 to 12 at Cabell Huntington Health Department. So if anybody would like to join that, that's a free training, and those are trainings how to talk to kids about drug use, lots of different prevention programs that are going on. We'll have lots of things going on in the fall here on campus too, so just pay attention to the website. We do several naloxone trainings that are free. We partner a lot with the health department to do that in our pharmacy school. Those are free events. You can learn how to give naloxone, and we send you home with free medication. But just pay attention to our website. We'll have a lot of events coming up in the fall.
There's also a DEA 360 event that will be happening at the University of Charleston on May 11th, and it's called the Compassionate Call to Action in West Virginia. So I wanted to make everyone aware of that.
Thank you. And I think we have one more.
I'm actually going to go back to the question before where they asked about were there barriers to, depending on your level of education. Part of that is because of billing. Part of that is we have a heavily Medicaid population here, and a lot of the billing goes to there. So how people get paid often depends on that. So, I mean, it's not just that they're trying to be difficult. It's that when you talk about reimbursements and monies for programs, all of that comes into play as to what people need in order to get reimbursed for Medicaid.
Good point. Thank you.
Thank you.
How about a big hand for our student panel? That's why we're here. Thank you very, very much. I know it's been a long day, but we're not done yet. Our next panel, these folks, our Students in Recovery panel. I'm going to butcher this. Deidre. I told you I'd butcher it. Deidre Beckett and Cassandra Chapman.
I used for a really long time, and I was able to come back to school in 2013 to finish my degree. I was an undergraduate major. I was a biology major. I started out in the pre-med program, and due to the consequences of my actions while I was using to support my habit, of course I got some criminal charges, and so I am a felon, and so when I came back to school to finish that bachelor's degree, I was really nervous. I had a lot of obstacles. I had to do a lot of paperwork, and finding out where to start to come back to school is very overwhelming, because I had dug my hole so deep. I had all these student loans, so I had a ton of debt. I had failed a lot of classes, so I had to file some appeals to even qualify for student financial aid. A lot of people that I work with currently, and they can't even come directly back to school because they have to get their loans back into good standing before they're able to come back to school, and that can take 6 months to a year because you have to pay on time so many payments, and so that makes it a really lengthy process sometimes. Luckily for me, mine were not in default at that time, so I was able to at least come directly back to school when I was ready, but it's kind of overwhelming coming back to school too in early recovery because there's so much going on in my life. I'm an emotional wreck. I don't know how to feel my feelings or deal with stress or cope with anything because I've just been putting drugs on top of it for a long time. And then I've got all these extra things that I have to do on top of the normal things that I would have to do to be in school. And then on top of that, I have a son, so I'm a parent. I also have the responsibility of keeping my recovery before anything else, because if I don't keep up my recovery activities, then I'm not going to stay clean long enough to even finish school. And that takes a lot of time too, and it's a lot of work. You know, I go to meetings on a regular basis. I sponsor people. I work steps. So I have to do a lot of things personally, and then you add all of this other stuff, it can be a little overwhelming, and it's definitely stressful. But as a bachelor's level student, like with the biology, and with a felony, I decided that I needed to go in a different direction because obviously, you're not going to get a medical license with felonies, and that's a really intense program. So, and even with the bachelor's, I was very worried about being able to find a job like in a lab or something where they do background checks and that kind of thing, where they would actually hire me. So I decided that I would like to help people, and something happened too in my recovery. Like once I started figuring out like what was important to me, like through working this recovery program, I found that like helping people and that type of thing was much more important to me than like the big paycheck. So I started to kind of learn some stuff about my values. And so I wanted to be able to use my experiences to help others. And so I applied at Marshall and to the counseling program, and I was accepted provisionally because my GPA was like a 2 point something, and because I just didn't come to classes and I would fail and fail and fail. So I'm super grateful to Marshall University and the counseling department for giving me the opportunity to come back to school and to do something different. And you know, when I first started, I thought I was going to fail every class. Like I would come and I'd be making good grades, and I still felt like I was failing because I just was out of my element. It was really uncomfortable. But, you know, I've been able to maintain a 4.0 since I've been here, and that's like crazy for me. Like it doesn't even feel real. So anyways, it's been a really, I don't know, it's an exciting thing, and I'm really excited at this point in time too, because when I first started using, and the first couple of times that I tried to get clean and stay clean, the atmosphere was not nearly as open for me to be able to come and talk about recovery or to come and tell you all that I am a felon and that I'm a person in recovery. It was, you know, there's a lot of stigma, but the problem has gotten so large at this time that it's kind of, we don't have an option. Like, we have to face, like, what is in front of us. And so, you know, as much as I really, you know, it kills me. Like, there are people that I know that die, like, every week. There's probably at least one person I know that dies every week. And, you know, it's pretty devastating and it's pretty depressing. But I also like to look at the upside of it, too, that, like, it's a conversation that we're having, and people are more open, and more people are interested to come and do the hard work that's necessary to get help to people that might not have been able to get it before. You know, when we make it like a community, when we take it out of like the jail setting and criminal justice, and that it's a moral failing, or that it's a, you know, a character problem, and we move it into where it's a public health issue, then we're actually able to like make a difference, and that takes a lot of the shame and the stigma away, and it opens up the doors for people to seek recovery. So I'm just really excited to be a part of that, and I'm really grateful for Amy Saunders. I just want to say thank you to her. I've been able to work with her a lot on some trainings, and gotten to share my recovery story, like with the SBIRT program, the screening and brief intervention and referral to treatment. I've gotten to do that. We're actually also working on some students in recovery things on campus to try and get a safe space for students who are in recovery to kind of get together and meet, maybe have some meetings, and you know, and just kind of exploring ways that we can engage the recovery community here on campus. And so I think that's really exciting too, because like in my story, when I was at Marshall, I was not really a part of a community, and that's where a lot of my drug use started. That's when it got really bad, and so I think that's really cool to be a part of that and be able to give back in those ways as well. Right now, currently, right now, I work at Oasis Behavioral Health. I just kind of help out around the office, which is a private practice behavioral health. I've completed an internship at St. Mary's. I also previously worked for Her Place, which is a women's recovery center. It's completely peer-based. It's actually under the umbrella of Recovery Point. And so I have been really grateful to. They provided a training in a program called Celebrating Families, and it's for those in recovery and their children as well, and kind of works to reunify the family. So I was able to be trained to facilitate that. My son actually has been through the program, and then I've been able to kind of come back and implement that as well. So that's a really great opportunity. And so I also worked at her place as a recovery coach, and that's kind of one way that I was able to, with a felony, I was able to go work for a place that was peer-based recovery. That gave me the opportunity to be able to work, because I still have a lot of fear going forward with my master's degree, that it's not going to be easy to find a job. As you've already heard talked about, like me going to one of the community mental health agencies in our area, it may not happen there. And it's going to make it much more difficult for me to find a place of employment, even though I have all of this relevant experience and I have great references and I've, done all of this work. It still makes it extremely difficult, and I have a lot of fear over that personally. But I do know that eventually, I'm just might have to work harder than everybody else, and I'm willing to do that today. I'm willing to put in the effort because, it's worth it. So, I don't know. I think that's all I have to share.
Thanks. Hello, everyone. My name is Deidre Beckett, and I am a master's graduate student in the social work program here. I'm also the project coordinator for Recovery Point of Huntington, and at her place as well. So I'm going to tell you, and it's funny because I didn't know the beginning. Me and Cassandra are really, she's one of my best friends in the world, and it's just awesome that we get to take this journey, into adulthood and do different things. And she's been so helpful with me starting, getting back in school, because what you were sharing, it's been very challenging. The last time I was in school was in I graduated with my, bachelor, see how long I can remember, 96. And, but like her, as she was saying, my journey was I started in 88, took a break because of my use. I started at West Virginia State University, but my first semester I came here, so I'm trying to get it all together. I had a scholarship out of high school for an outstanding black student in 1988, so I came here for a semester, and it was the first time I'd had any freedom. And I had used a little bit, but there was not a big problem that I saw, so when I came here, immediately it got really bad because I had never been away from home, so I had a lot of freedom. And so I was here for one semester, but then I went back to Institute, where I'm from. And I started at West Virginia State University, and where it's not a college campus, I did a lot better there because I was from that town. So there wasn't a big party scene. And so I was able to go to school for a while and maintain my use without a lot of consequences. And some point, about 2.5 years into that, I did get really bad, and I dropped out of school. But at some point, I went to treatment. I came here. I always come Huntington because this is I'm real familiar with it. I came here and went to, it was a Prestera facility, I believe, called Park West. Yeah. So it was a long time ago. So I came here, and I just, Cassandra talked about, I wasn't quite ready. I was really young. I maintained for a little while, and then I went back to Charleston. I went back to school. I started using again, introduced to a 12-step fellowship. But I just didn't take a hold. I just thought it was just an accident, and if I just, trying to change some of the people and places, I wouldn't end up in the same situation. I didn't understand what substance use disorder was, and how it could affect you, and how it was a long-term situation, not just a temporary accident. And so what I did is I went back and I graduated from West Virginia State University with a bachelor's in psychology in active addiction. And I don't know how that happened, but I was able to, and my grades were pretty good. Still using, I signed up for graduate school, and I entered the clinical psychology program. And I was going to school, and I think maybe the classes were more challenging because I dropped out somewhere in my first year of grad school there. And this was, like I said, it was a long time ago. I worked really hard, but it was just, I couldn't keep up the work, and my use was becoming a lot worse. So I dropped out and continued in active addiction. Had a daughter throughout this. I've had periods of recovery, but was never to stay stopped. And but I've learned a lot of the reasons why that was, because I didn't commit to a 12-step fellowship. I didn't commit to any complete change in my behaviors. I would change a little bit, but not everything. And not everything would always get me. So, through trial and error and through, a lot of relapses. I've learned a lot about myself and a lot of things that I can't do. This last time I was out, I also have a felony. I actually have 2 felonies. And what's interesting is that I hear people talk about challenges. My first felony was when I was 19, and it was very, very severe. But at that point, for some reason, like after I got myself together, I got a job. I was still trying to better myself, and throughout my life, I've always been able to maintain some type of employment and still excel until like my addiction got so bad, then it would stop me. But I think a lot of what I see people go through is they say, well, I can't get this with the felony. I can't do this. Well, I am an example that you can. I have to work really, really hard. I have to, if I work at McDonald's, I never miss a day. I show up and I do exactly what I'm supposed to. And the minimum wage jobs I've received since I've been in recovery, I've been promoted to a supervisor at almost every single one of them. And it's not because of, it's because of my recovery, and I live my recovery outside. So I do what I'm supposed to, and when people take on jobs, people see that. And a lot of people notice that people that are reliable, they will work with you. They will try to help you find ways to get through the background issues because actually, since I've been here, I went through another facility that's amazingly, Prestera, and they've been like a big part of my story. And I've always took advantage of any opportunity that was out there. There was a place called Kisra, and there was a job readiness program. I had a bachelor's degree, knew how to write a resume, but I took that class just to refresh myself and just to get some more experience. Prestera offered the peer support training. I had an ankle bracelet, so I didn't have a lot of things to do. I took the peer support class, even though, I like to give them back, but I always try to learn more because it can't hurt. It can never hurt. And by taking the peer support training, I was able to, and Ronnie's been part of my story too. I talked to her a lot on the phone trying to go back and find the jobs I had and the experience I had because I was able to receive my peer support specialist credential. I took because of the Prestera class, and that, like everything I've done is built on and just, I didn't think, didn't know how well it would help me. But by doing that, I started volunteering at her place. And I just, like I said, recovery's taught me to give back. So when I had free time, there was no expectations except for I wanted to work with people in addictions. And I had a lot of lived experience. So I just started doing that, and at some point, they were able to give me on-the-job training because the Division of Rehabilitation Services helped me do that. There's agencies out there, and I always share with that, every little piece helped me to get here, and had no idea that I would even think about going back to school. That was never a thought in my mind. I wasn't against it, but it's been such a long time, and I'm afraid of a lot of things, and like people in recovery, a lot of people are afraid of failure. And, I was kind of comfortable, and why mess that up? But this inspiration beside me, she was going to school, and I started, maybe thinking, and I'll tell you, I went to, it was a homeless volunteer thing, and I think I went as a representative from her place. Dr. Harmon was there, and we started talking, and she was asking me my background, and she knew I was in recovery, and she said, well, we're going to start this master's program. She said, you should, try to get in, and I'm like, why was she... Because she asked me and thought I could do it, I started thinking, well, she wanted, you know what I'm saying? And that gave me like, okay, well, the lady that's doing the program asked me what I joined, so maybe she knows something about me that I don't know. But, it just kind of encouraged me. So I applied, and I had to, write a letter and explain. What was amazing is that my graduate school, somehow I made a really, really good GPA, so I didn't get on academic. I don't really remember much of it, but it had one incomplete and all A's and B's. So, like I said, it's just the journey has been super, super long, but I got accepted into the Master Social Work program and didn't know how to register, didn't know what Blackboard was. I knew where the campus was. That's about, and Cassandra, she helped me register. She helped me, maneuver through Blackboard. It means a lot to me because it was scary. And I always joke with, classmates. Last time I was in school, I had the floppy disk and the hard thing, and they were like, most of them didn't know what it was. So I was like, okay. But you know what's amazing? I'm so, so grateful that I've done this because I've got more confidence in myself than I've probably ever had. And 1 year, I think I've learned more in this year than I have in my undergrad and most of my high school. And it's just because I was open-minded, and I just want to thank the the faculty for the Master Social Work program, because they will not let you fail. You have to actively really want to not succeed. I mean, I've never seen people, like, they answer questions. We have cell phone numbers. They answer emails immediately, and they go above and beyond, which makes me, it's more comfortable because I can ask them anything and it doesn't feel like a dumb question. They've really, really helped me. And I had to share this because I'm doing my practicum at Recovery Point, where I work at. And when I talked to my supervisor and they gave me the assignment, I had to share this because it was like they wanted me to do a gap analysis research. And I'm in my first year of the master's program. I've not had a research class since. And I was like so sad because I'm like, I can't do that because I just overwhelmed. So I went back and started doing research, trying to figure out what he was asking me to do. I just was afraid immediately. And I'm almost finished my paper. I did a survey. I used the SBS data system and plugged in numbers and did correlation. See how I did this? I'm really impressed because I really just was like upset, but I've learned. My teacher said, you should get that published. I'm like, really? Published? Okay. I'm really amazed because it's like big stuff for me, not using Blackboard to doing a research paper and, evaluating correlations and stuff like that. It's a big jump. And that's what Marshall does for me. They are always there, and like I can go to their office when I don't understand something I'm doing, and they'll take a minute out to show me. And not every school has that, you don't have that advantage because a lot of times there's so many students you can't help everybody. And, you just have to like go do it on your own. So I'm just really grateful that I took a leap of faith because I can't imagine where this can take me. And the other day I spoke at Professor Larson's substance abuse undergrad class. And I went there thinking I was going to share for 30 minutes. I spoke for 2 hours. And they could leave. What was amazing is that they could leave when I was done speaking. So I finished like in 30 minutes. And they were like, and I was going, do you ever realize you can go home? You don't have to. And they wanted to know what I was talking about. One of the ladies said she had learned more than, stuff she had never thought about from me coming in. And so not only my lived experience but it's the therapy and the clinical aspect that I can, help people, because I love people, working with people in recovery. But I had one side to work with them, lived experience. Going through the master's program, I can do therapy. I can do the other stuff that a lot of people in recovery are lacking because, we can tell them about 12-step and they can go to a therapist, but it'd be so amazing to have a therapist that knows about 12-step recovery, all in one person. So I'm really, really grateful for this journey. And I could talk for days, but they told me I only had 7 minutes. No, I'm just kidding. Okay, but I'm really grateful. Thank you, Amy, for asking me. Real quick, I also am, like I said, a peer support specialist. Currently, I am doing the recovery coach training for Recovery Point, and we do that online. Mark Drennan was here. We use the facility in Charleston, and we have 23 people. It's on our website, so if you know anyone that's interested, they can always put in an application and get in our next class, and that's pretty cool. I get to help people like all over the state through the TV, okay, I'm just kidding, through the internet, because which is different, like not being in a class. I'm not only affecting the people here, but I had like 3 people in Morgantown, a couple people in Princeton, all over the state, giving my shared experience on, how to help people in recovery. It's just been an awesome journey, and I think that's it.
Set it down for that.
Thank you both very much. Does anyone have any questions they'd like to ask them? I'm sure they would entertain that. It's a remarkable story, ladies. Go ahead, Patrice.
I was just wondering, from my story, like, college is where I discovered music, and it offered the most that it could ever offer me. So how did you guys deal with that in the college setting? Get new sobriety along with other peers that were just discovering, you know what I mean? I mean, I'm sure that had to have been something. So how did that happen for you, though? How did that work?
Well, when I first arrived at Marshall, of course, I had started using it at a young age and just partied a lot. I had not been introduced to any kind of recovery because it was like while I was here in that first, undergraduate period, those first few years that I really liked my use. That's when I was introduced to the drug that really kind of brought me to my knees later on. And so, but for me, like, things changed because I was in a different social circle, and the people that I chose to surround myself with once I got here away from home was very, and they were just different, and they were more advanced in use. And so when I came back to Marshall, I had a very close network of people in recovery that I generally associate with. I know multiple people here on campus that are in recovery, you know, and I just am careful about, like, what events I attend, who I attend them with, because I will say, once I came back to finish my bachelor's degree, I had one class that I needed to take to finish my undergraduate. And so I signed up to take this class. I was in a class with a lot of graduate students, and we would go out in the field, and alcohol would always be, like, we would go have lunch, and everybody would always be drinking, and that was a really high pressure situation for me, and it did not end up well. That's not what, like, caused my relapse or anything, but it was very, very uncomfortable for me, and I was very early in recovery, and it was not. It was really not conducive to my recovery or continued to stay clean. I ended up relapsing for a short period of time and was able to come back, and I built a much stronger support system with ladies that also work a 12-step program and that are actively, like, in recovery. And so I just make sure that, like, my social aspect is very strongly rooted in people that are staying clean and sober.
And anytime I've been in school, I've always been in active addiction. So I've not had a lot of experience with coming, except for this time. And it was interesting because I was kind of nervous about disclosing that I was in recovery to my class, because I'm a lot older than the people there. So it was kind of scary. But as I sat there and there was a topic that came up about resiliency, and I will never forget this. And I, talked about being in long-term recovery and that, I was resilient. And it was just amazing because on our break during that class, people came up to me and asked me, about where I worked at. Not anything about my personal life, but they treated me the exact same way the entire time. And that, for me, is disclosing, and I've never had an issue. I have friends, really cool friends, but they never ask me to do inappropriate things because they know where I come from. They're like, we're without alcohol here if you don't want to come, so I've put that out there, and I think that for me that's always worked because I have to disclose, because if not, I put myself in situations where people will offer me not knowing, and one day I might say yes. So for me, disclosure in that situation has always worked best.
Thank you.
Okay, we have one question.
I just want to tell both of you all that I'm so proud of you both. I've known Cassie and Dee Dee for a long time. We met each other at her place when that got started here, and they've just grown tremendously. So you all are going to be fabulous therapists one day, and I can't wait to see you.
So I'm one of Dee Dee's student peers in her class, and I just want to say that Dee Dee has been absolutely fantastic, and what she brings to the table in our class is really, really important. And I've seen you grow so much in this past year, and we think the world of you. And it's funny because I often forget that you're in recovery. It just doesn't really, I know you work it, you do it, and you talk about it, but I mean, that's not what I think about when I think of you. I think how brilliant you are. You're doing such a great job, and you grow. You're open to, you'll say, I've been thinking about this all wrong. I got to think about it this way, and you're so open to that, and you give back so much, and I'm super proud to be your friend.
Again, thank you both very much. Good luck, and thank you for sharing your story. We're getting near the end. Okay. I'd like to introduce now a colleague and a friend and someone in the room that has been at this as long as I have, which is, that's hard to do because she's younger than me. But anyway, I'd like to introduce to you Ronnie Rittenhouse. Dr. Rittenhouse is on the West Virginia Certification Board for Addiction and Prevention Professionals, and she's going to talk to you all a little bit about that because, we talk about, how do we get folks into this profession, but it's not just about getting you in, it's about making sure that you maintain the highest quality level of professionalism within that, and certification and licensure and all of those are important ingredients. So getting in and staying connected, that's what Ronnie's going to talk to you about.
Thank you. Yes, I always tell people, I knew Jerry when he had hair.
So you know that was a long time.
Well, when I was 27, I was living in California, and I made the best decision I have ever made in my life. I moved to a place where I had never been. I didn't have any friends. I had no family. And yet I decided to come to West Virginia. And that was in 1974. Best thing I ever did. A couple of weeks after I got here, I got hired by what we used to call the Division on Alcohol and Drug Abuse, and worked at a state agency for 5 years in Morgantown. It was funny that the counseling center for people with drug problems was located on High Street. So West Virginia is a wonderful place if you want opportunities. It was for me. And Marie, I just have to tell you this little quick anecdote. Around 1976, I got invited to provide testimony to the House of Representatives Select Committee on Narcotics Abuse and Control. And my topic was treatment needs of rural women, 1976. And one of my main points was we need treatment for women where they can bring their children. And that was 1976, and we're still working at it. All right, the Certification Board is a member of the International Certification and Reciprocity Consortium. That's our mother board. Just like WAVADAC has a mother board, NAADAC, well, ours is called ICNRC. And they set the minimum standards. Now, if we want to make the bar higher, we can do that, but we can't make it any lower. And so people that get credentialed in West Virginia, they have to maintain a certain amount of training. They have to maintain excellent ethics, and if people get reported with ethical problems, then we try to help them repair that problem, but they can lose their certification. We have one credential that is not a professional credential, and that is the Peer Recovery Support Specialist credential, PR. And there are requirements for all of the credentials, including that one. But a very important requirement, which doesn't apply to the other credentials, is that you have to be in recovery in order to get the PR credential. Because after all, it's the peer recovery support credential. So peer meaning, we're equals, we've been through it. The other credentials that we have, the ADC is the Alcohol and Drug Counselor, and you do not need even a bachelor's degree to get that. You have to have a high school diploma or a GED, and you have to have 3 years of experience working in the addiction field. Yeah, you're going to get there. I'm sure of it. She's looking at me like, yeah, I'm next. She will be. Okay, so you need 3 years of experience working in the addiction field. You have to have a certain amount of training that is addiction specific, and that's true for all of the credentials. There's a certain amount of training you need and education, a certain amount of work experience, and so on. The one thing I forgot, this is in your packet, but it's in black and white. I forgot to put our web address, so let me just tell you what it is. Of course, www.wvcbapp, that's all the initials that are spelled out right here, right down, wvcbapp.org. And when you go to the website and you click on certification, you can look at the manuals and the applications for all of the credentials. The advanced ADC, the Advanced Alcohol and Drug Counselor credential, calls on having a master's degree, and you have to have 1 year of addiction-specific work experience post-master's. There is a credential for people interested in criminal justice. There is the CCJP, which is the Criminal Justice Addiction Professional Credential. The CS, the Certified Clinical Supervisor Credential. And PS, Prevention Specialist. I know there were people in here asking questions about how can I help now. Try to get yourself involved in prevention work with some of the coalitions that are happening in just about every county in the state, and you can get started now. Okay? So the handout lists all of the credentials. I don't want to, have to hash out what is involved in each one. But if you have any questions, I'd be happy to take them. It's been a long day, and you all have been a great audience. And thank you for coming today. Really great. Thank you.
Thank you, Ronnie. And again, just so for folks that aren't real familiar, there's a membership organization, which is the West Virginia Association of Alcoholism Drug Abuse Counselors, and then there is the certification board, which certifies. You don't have to be a member to be certified, but it certainly helps because it becomes the bridge for continuing education and for fellowship and for working with peers. So I would encourage you, as a student, if you're not a member, become a member of the West Virginia Association of Alcoholism Drug Abuse Counselors. It'll connect you, and you can become part of the club, which is a really unique group of individuals. Okay, very long day for everyone here and all of our folks that have been live streaming. So we'll turn it over to Cynthia, and we're going to do a couple of drawings, and then we're going to wrap it up. Cynthia?
Thanks, Jerry. We've heard a lot today. We've heard about the need for workforce. We've heard about the realities in the workforce with the providers panel. We've heard about the college programs and the student perspectives, and we've heard about the recovery and student perspectives. A lot of different paths, a lot of different ways to get to being in this profession. We heard from Ronnie about certification. I know she gets calls all the time. So if you have questions, please do not hesitate to call her. And so we're at that place where we're going to do a drawing, and you have to be here to be present. So we may be going through a couple tickets to get to that place. I know people have had to leave either to go back to class or back to work. So I'm just going to ask for your patience as we do this. Heidi Ann, will you come up and help assist with this? So get your little blue ticket out with your numbers and be ready to rock and roll. And those of you that are satellite streaming, I'm sorry that you won't get to participate in this. However, you can see the cool gifts. Okay. Oh, what are you drawing for? Well, Ronnie, can you tell us about your gift? Oh, actually, I think I'm just going to take this one. Oh. Oh, it's a size medium, and it's adorable. Okay, so Ronnie says you can wear it by itself or with leggings, or, well, we won't even go there. Go ahead.
398255. All right. 224. 224. Last three digits, all right. I know. 242. 226. No. 241. 240. Didn't I hear someone say they had 240? No? Okay. That's really the number. 247. 248.
Yay, yay. So this way we know that we've gotten through some of those tickets. Okay. And this is a beautiful block print reduction living room, and it is gorgeous. And this is also from Ronnie, right? So let's see what ticket number comes up.
215. 211. 232. 233. I really should just ask you guys what your numbers are, and then you should draw again. 227. Wasn't it? Yeah. 257. 256. This is funny. 259.
Getting warmer.
214. 213. 222.
That sounded like a really good number.
225. 229. Yeah.
Did you all put your tickets in there?
Okay. 254.
Yay! So our 2 students in recovery. Thank you. Okay. So we're going to do this together. This is also from Ronnie. I think that's adorable. And also with it the first international convention of Alcoholics Anonymous on tape. On that actual tape, yes.
Okay. 253. 228. Right, there's 2 numbers in here. 219. 264. 207. 207.
Yay! What was that? This is adorable. You're welcome. Okay, and now we have you can be a Valley boy or girl. This is a Valley shirt donated by Jerry Schmidt.
258. 261. 236. 235. 220.
Yay! Woo-hoo! Woot,
I'm going to wear it, too. I got friends at Valley.
That's right.
I'll wear it to work at Prestera Center.
Yeah.
My Valley shirt.
Oh. No, oh, is that one that you already read?
Did I read 212?
No, you didn't read 212. 212 now. This is another fashion statement.
A
NAADAC. Long sleeve, long body.
272. 274. 'We can get you. 206. Yeah, we have a winner.
Hey, Joe. Congratulations. This is a NAADAC shirt. You can wear it under your suit coat. You're welcome. All right, and now we're going to do, oh, you can.
All right, we have a lovely book, Rain in Your Brain, from maybe Miss Cynthia Morano Tui did it, yes. It's about from impulsivity to thoughtful living and recovery. All right, 208. 209. Oh, 208? Whoever gets up here first.
All right.
Yeah. All right.
And now we have a Valley portfolio. Everyone needs one of these when they go to work, right? To take notes and stuff. This is pretty cool. I don't know, Jerry. I think I want to win this one.
I can hook you up.
244. 245. 273. Oh, I'm so close. 271. 239. Should we give her the
We'll give you then.
Wait a minute, we're going to give you something else.
Yeah. We're going to give you something else. All right. So this is the NAADAC blanket that opens up. On one side it's plastic and on the other side it's warm. So you can put it on the ground and have a picnic. Yeah. So now we'll go back to the portfolio.
238. 237. 269. 210.
Yay! Congratulations.
Thank you all.
Yeah, we have one more.
One more.
Thank you. We have a theme going here. This is a NAADAC umbrella. So
251. 267. I knew I was a winner.
You are a winner. You all are winners. You all are winners. And for all the speakers today, and I know some of them have already left, so we'll give some to go. And for the planning committee, we wanted to share, we'll just show you what we're sharing. We wanted to give them a gift of a dream catcher. And these are real Native American dream catchers. And we wanted just to say to all of you to continue to follow your dreams or catch your dream that you can follow. And thank you so much for being here and being part of it. Please feel free to go visit the exhibitors now. They've been patiently waiting. And yes, if you haven't filled out your evaluation, we really need your evaluation. Please feel free to give your comments. All right? And we'll just turn in your evaluation on your way out at the door. Thank you so much. And thank you.